Morning, everybody. This meeting is now called to order at 9:01 with a moment of silence, silent reflection, or silent prayer. Thank you. Mr. Elliott, would you like to lead us in the pledge this morning?
Please rise.
Thank you. For the record, Tuesday, April 28th, 2020, special board meeting for the San Joaquin County Board of Supervisors. Will the clerk please call the roll?
Supervisor Villapudua?
Present.
Supervisor Patty?
Yes, ma'am.
Supervisor Elliott?
Here.
Chair Miller?
Here.
And for the record, Supervisor Wynn is absent.
Thank you. Now we're going to move on to public comments. As I hope the public is aware, these meetings are available live stream on the county's website, and you may submit public comments both in advance of the meeting and during the meeting. We ask that you limit your comments to 250 words or less, and you can submit them by sending an email to the clerk of the board at cobrecords@sjgov.org. We ask, please, no personal attacks. I'm going to ask the clerk to read any public comments we have received, and I'm going to note for the record that Supervisor Wynn has just joined us. Welcome.
Thank you,
I want to
Madam
thank you,
Chair.
but I was stopped by 2 highway patrol cars, 2 animal services vehicles, and 1 large truck across the freeway north of French Camp. I have no idea what they were chasing, but eventually they got rid of it. No.
Well, we're glad you made it,
Traffic was stopped.
even though it was an eventful commute.
Yeah, I wish I could have seen the firsthand. Anyway, thank you.
Thank you, Madam Chair. The first comment is from Laura Ganeko, and she writes, I was deeply saddened and terrified to hear that in the middle of a pandemic, while we are not getting enough testing and our numbers are still rising, you voted to let people on golf courses and public places. There was no poll or vote from the people of San Joaquin County. You were told by the Trump administration, it was on every news channel, that federal monies will only be given to people who test positive for the novel coronavirus 19 only. Your reckless decision to open the public places, especially without a cloth covering over the mouth and nose, and not staying in solidarity with the Bay Area mandates, puts the lives of our skilled first responders more at risk and greatly destroys our San Joaquin County chances of receiving all the styles of test kits we so greatly need and the federal funding we deserve. Shame on you. Please reverse your reckless decision now. Laura Ganeko. And Barbara Barragan-Perea writes, grocery stores are not consistently enforcing county orders. Since early March, my only public outings have been for groceries once every 7 to 10 days. I have continuously changed grocery stores because staff have not been masked or gloved at most stores. A number of stores still don't have plastic dividers up. But worse, even the few stores cleaning baskets and with employees with PPE like Trader Joe's and Raley's, a majority of customers are not wearing masks and ignoring social distancing norms. Shouldn't all grocery stores be insisting that customers wear masks? And shouldn't they be limiting the number of people in a store at a given time? This is what they are doing across the Bay Area and in Sacramento. Where is the enforcement and public health messaging? Why is San Joaquin County continuing to function like a small rural county when it has 800,000 residents and big urban centers? If standards cannot be set and followed, how will we ever successfully open businesses without infection surges? The board and administration need to stop following the lead of rural San Joaquin Valley counties and start recognizing that they are part of a major metropolitan area that reaches from the Bay Area to Sacramento and develop pandemic policies accordingly. And Beth Lambden writes in, thank you for your leadership and work during this most unusual season of life in our county. I hold you up in my prayers for wisdom and strength. When I went to draft this letter concerning faith-based gatherings, I realized that between Friday at 7 p.m. when I originally screenshot the summary of the order and now, the following words have been omitted, quote, with windows fully closed, end quote. I have included the comparison of the different documents with this letter. While I am pleased that those words were omitted and that you actually are not wanting to tell people to sit in their vehicles for an hour or more with all windows fully closed, I am asking for full transparency as to how this came to be in the document on Friday and then how it came to be removed. I'm also asking why there is not a statement saying the document was updated and what wording has changed. In addition, I would respectfully ask why you decided to require restrictions on faith-based gatherings that you are not requiring of others. For example, you can park closer than 6 feet in any parking lot or street in town. I believe the virus can't go through metal. Anyone can be out of a vehicle practicing social distancing anywhere outdoors. In addition to this being nonsensical, you are actually discriminating against church attendees who do not have vehicles. You can pass food, literature, and money between any essential business currently open. I look forward to hearing your response. Beth Lambden. And Madam Chair, that concludes the comments that we've received for the meeting.
Thank you. Okay, then. We're going to move on to our consent items. And our first one, even though it's on consent, we are going to have a brief presentation on approval of emergency master occupancy agreement between San Joaquin County and G6 Hospitality Property, LLC, doing business as Motel 6, located at 817 Navy Drive, Stockton, California. Authorize appropriations increase in the 2019-2020 project room key budget by $418,000. And I saw Mr. Woods here before.
Madam Chair, we do have David Tolliver on conference call. And
Okay.
I believe he may be available to speak to this item.
Perfect. Then we'll turn it over to David Tolliver first, and we'll see if in the meantime Mr. Woods also enters, and perhaps Mr. Cheshire as well. Good morning, Mr. Woods. We're trying to get Mr. Tolliver up on the conference call. Oh, here he is. So we'll let you two do a little update for the board, a presentation on this item.
Okay. Good morning. Can you hear me?
Yes. Good morning, Mr. Tolliver.
Okay, being so I'm standing here in front of you, I'll go ahead and start, and then David can supplement as necessary. So,
Good morning. Can you hear me?
Oh,
Apparently he can't hear us.
so I'll go ahead and get started. So good morning, Madam Chair, members of the board. Before you this morning is a proposed occupancy agreement between San Joaquin County and G6 Hospitality Property, LLC, known as Motel 6. The agreement will provide 76 motel rooms to provide isolation capacity for at-risk homeless individuals. And those at-risk individuals are identified as being asymptomatic and over the age of 65 or with underlying health conditions. The total estimated cost of the lease for the period of May 5th through June 30th is $298,908. And the total cost, which is reflected in the board package, the total cost that's inclusive of operational and supportive services for the period of May 5th through June 30th is $499,510 for a total of $798,418 for the 57-day period. terms of cost to the county, the funding is SB 89 funding that's available. We have not, this budget is not expecting FEMA reimbursement. FEMA reimbursement for Project Room Keys statewide expires on Thursday, and there's no expectation or guarantee that FEMA approval will be provided. So we've been engaged with the state as recently as yesterday. This seems like the longest week ever. When I think about it, it was just yesterday. And in response to our request for additional funding for Project Room Key, should we be able to identify a hotel or other location for COVID positive individuals. So I just want to reiterate that this property is, this hotel lease is for individuals who are not COVID positive. And despite the announcement that the governor did last weekend with Motel 6, when we did engage with Motel 6, and this is their corporate, these are corporate-owned properties that were made available statewide. Motel 6 was not willing to take COVID-positive individuals. And just yesterday, we reported this to our state folks, which was some news to them. I know that some folks at the state were aware of this, but the folks that are entertaining additional requests for the $50 million pot, we're not aware of this development. So in terms of identifying folks that would be referred to the motel, we've done tremendous work throughout with the county partners to identify HMIS, and I think Adam could probably speak to sort of the number of folks that may be eligible to this housing arrangement.
Yeah, thank you, Director Woods. So just over the last 24 hours, some significant work has been done to develop what we call a by-name list of individuals who are homeless in San Joaquin County and who are in our homeless management information system. That list is ordered by age. As an example, the person who is number 1 on that list was born in 1928. It goes down from there. The intention being that that metric is readily available in the HMIS for every individual that is in the HMIS. It is not the only high-risk factor that will be considered. This list is obviously, in terms of privacy and confidentiality, that is important. This list is going to be shared around to only folks that are involved in Project Room Key and to include the city managers. The request that I'm making this morning will be to ask those city managers to identify individuals on that list that they believe will be important, that are high risk. It's important to say, you know, we've got a list of folks and their names and their ages and maybe some other information, but not necessarily the information that you can gather on the ground by interacting with these individuals. So that's the kind of information that I'm seeking from the city managers of Lodi, Manteca, and Tracy in order to ensure that we are geographically distributing the opportunity for folks to enter Project Room Key. So that will be completed, I have no doubt, before Project Room Key is ready to be occupied, and we should be able to pull at least a few folks, or certainly at least provide the opportunity to the outer communities to pull a few folks into Project Room Key.
And what sort of capacity you think you're just going to be able to use these full number of rooms immediately? I mean, it seems like just based on the larger shelters that there would be enough people to use up these rooms and to help alleviate some of the crowding in the shelters so that they can practice better social distancing.
Yes, and I think that was really important, what Adam described in our efforts to look at what is the population out there in terms of who is at risk and would meet the at-risk category, as well as knowing that protecting the financial liability of the county in terms of a 50% occupancy that we must pay for. So we have to pay for 38 rooms no matter what. And we strategically pushed the start date out to May 5th for the purposes of ensuring we had a week between, if this is approved by this board, we have a week to operationalize this, because we were relying on vendors who frankly are not sitting on food that's ready to prepare and deliver to these rooms, or have staff available because they've sent staff home. So they need to recall staff, get supplies in place, and be ready to operationalize. And I thought that giving us a start date of Tuesday, May 5th, gave us the best ability to be successful from day one. So between now and between board approval and May 5th, we'll be cultivating this list of individuals and initiating operational supportive services.
Just to give a sense, the number of individuals on the by age list is 414. So with capacity for 76, I don't think there can be any doubt that we should be able to, assuming that we're able to kind of engage everybody involved to get this location filled up very, very quickly.
And so what's the plan for June 30th?
Well, and I think I know I've shared with this board, the issue is that this funding and this effort is not going to solve homelessness for these individuals. I'll be very direct and upfront about that. That was never the intention. It's really to provide that isolation capacity to protect them and to protect the healthcare system from a surge. And realistically, these individuals will go back to their previous situation, just to be very direct.
So they'll go back to either the shelter or to an encampment, wherever they are pulled from?
Or more than likely. I think that there will certainly be opportunities for county partners, whether it's behavioral health, who is servicing some of these folks with their severe mental illness or substance abuse issues, or community medical centers who will have access to these individuals to provide services. It might give opportunity for those services to be more effective when folks have a place to stay and enhance engagement. That would be, I think that's certainly a benefit, but I would not rely on that transitioning into any sort of permanent housing situation.
And do we feel like this need for isolation will be done by June 30th? Or, I mean, this is clearly a more high-risk population than the general population. And so, you know, even if the general population begins to see a relaxation of various orders and a return to business and activities, is this a population that we believe will not require continued isolation?
So we do have the opportunity to extend the lease through September 30th. Corporate Motel 6 has been very clear that beyond September 30th is not an option at this property. But I think what I heard yesterday and when we spoke with the state is they're actually encouraging counties and cities to implement 30-day plans as opposed to 60-day, or this is a 57-day plan, because the situation is so fluid. And I'm sure that is also tied to availability of funding as well.
Exactly. Thank you. Supervisor Wynn?
Thank you, Madam Chair. What's the data in regards to this particular population as far as experience for the last 6 weeks? I mean, have these individuals been infected, contracted?
No.
Is there any cases whatsoever?
No. To my knowledge, no homeless individual in San Joaquin County has been identified as COVID positive to date.
Okay, so if we go through this program until June 30th and they return to wherever they came from, then chances are that their life will go on as it has prior to their use of Motel 6. Is that correct?
I would certainly hope so, and I would just share that in preparation for this strategy, I did reach out to our EMS partners, Dan Birch in particular, to discuss, have we seen homeless individuals entering the healthcare system, the emergency room system, and having difficulty being discharged? At the time, I think this was probably a week ago, that was not the case. So trying to assess the impact of homeless individuals on the emergency rooms, it was not a significant issue. I will share that I think as testing becomes more prevalent throughout the county, there will certainly be homeless individuals who test positive. This strategy doesn't serve that population. This property has not been available for those folks. So our intention is And that was not a decision of our own. That was just the nature of what the Motel 6 corporate was willing to take on. And so COVID positive folks will not be residing at this Motel 6 property.
So it is intended to relieve some of the pressure on some of the shelters, correct?
Yes, absolutely. It'll relieve stress on the shelters and will certainly protect individuals from becoming infected in a congregate care setting.
Okay, thank you.
Supervisor Patty?
Thank you, Madam Chair. A couple quick questions. Services, meals, and things. How's that going to be implemented, and who's going to pay for that?
So SB 89 is available for all of the supportive services. And my team at HSA has been actively engaged in lining up services. And that was one of the aspects I explained earlier. It was really important that we had this week lead time so we could allow our vendors to get in place, because there's a lot of specific details that our folks are working on. And we are going to deliver 3 meals to each room per day, and those will be delivered not all at once, but at breakfast there'll be a delivery, lunch a delivery, dinner a delivery. So I think that we have been lucky to find partners in the community that are willing to work with us and work with us at a reasonable cost.
Excellent. And what type of preparations are we taking for the rooms, the furnishings, and what those rooms are currently furnished with?
Excellent question. So we actually will be doing a pre-inspection. That is something that General Services has agreed to do for this project. Documents the condition of the rooms prior to occupancy, as well as we're going to ask the property owner to remove items that are frankly just unnecessary in the room, glasses, and I'm not exactly sure what is all in the Motel 6 rooms, but things that aren't bolted down that aren't necessary for our program, we're going to ask them just to alleviate additional liability concerns.
Excellent. And in a prior, just to share along those lines, in a prior conversation with Fresno, they had done a similar program a while back, and everything was gone from the room. They had spent several $1 million actually refurnishing and repairing once that population was done being taken care of through a motel over there. So I would even suggest maybe wrapping the mattresses in a heavy plastic or some sort of protection before the sheets are put over it. And anything that's in there is likely going to need to be replaced based on a high degree of damage that could occur, and history has shown will occur with some people that might be located in those rooms.
Yeah, and I know that I'm aware of an Orange County example where they did have to spend, and I don't know all the details, but they had to spend a significant amount of money to restore a property. And I certainly don't want the county to be in that situation. Unfortunately, in terms of liability, the county is responsible for bringing the property back to like repair condition, as well as the county is responsible for the conduct of the resident. So if a resident does something that causes damage, the county will be responsible for that. So there is significant liability, and I know county council has been very helpful and diligent in addressing liability to bring it to the point where it is in this agreement, which is the best possible scenario, I think, that's realistic for the county. But liability is certainly a concern, and charges for bringing the hotel back to like repair condition or any other liability issues are not reimbursable by SB 89 funding. So that will be purely county cost.
Sure. And is there any opportunity, looking at the provision of the repair and maintenance, it talks about how the county would have to reimburse the cost. Do you feel we have the opportunity to maybe a nonprofit organization can come on in and repair anything that happens before an operator comes back and maybe charges us more money? So do we have that ability to fix and repair it, maybe not at a high cost, but finding an organization that might come in and do it at a much lower price?
I like that idea, but I think the agreement actually specifically states that the motel would make arrangements in coordination with the county to address what the potential costs are. and the motel gets to make that determination of how those costs are actually, or excuse me, how those repairs are done.
Got it. That could, there could be a long period of time for repair that we're now paying for the rooms that are out of service, and it could be at a much higher cost than what we might be able to get done through a nonprofit that might willingly step in and help us out. But I'm not sure if it's negotiable at this point. But it'd be nice if we had the opportunity to put it back in its original condition or better.
Certainly agree. And I don't know if David Tolliver is able to weigh in at all on this aspect of the agreement phone, but sounds like he's not. So, but I know that there are provisions in the agreement and that relate to expediency of those repairs being done, so the county isn't sitting there paying for 38 rooms that we're not using.
Got it. Understood. I have a question through the chair. I'd like to ask a county council a question. Supervisor Wynn brought up a question: is like, what happens with these individuals after they vacate, and they may go back to where they return, or to the current shelters that they might be utilizing. What is involved in the county declaring a housing emergency, a shortage of some sort, so that we might be able to activate a location if we were to progress down that road and utilize a space that might be identified that could house people, but it may not be at current occupancy standards without a declaration of emergency being declared. Do you have any knowledge on that? I believe you and I chatted about it of months in the past.
I think that the county has already has previously declared a housing emergency.
So we'd be able to.
Is already in effect. Now, I'd have to go back and look at what that statute, what kind of latitude or additional powers that grants because of that declaration. I just don't recall it off the top of my head. I'm happy to do that.
Okay, as a follow-up, maybe I know, my office, I'd like to read a little bit and see what we're allowed to do if something like that were to be presented to the board as an option. Because, we all know, COC is working on it, Mr. Cheshire is working on it, everybody's working on what we can do, so I'd just like to maybe have a little bit better understanding. Or do you perhaps know, Mr. Cheshire?
Again, off the top of my head, I don't recall the specific provisions of the statute that was cited when the county made that declaration. I will say also the city of Stockton and the city of Lodi made that declaration. That was in order to apply for homeless emergency aid program funds. That's probably a good year and a half, 2 years ago now. So I would certainly defer to County Council Miles to follow up regarding the statutes and his interpretation. Relatively simple, as I recall, and was really designed to remove a lot of the liability that a jurisdiction might experience around providing emergency housing that, as you mentioned, maybe doesn't necessarily meet all of the occupancy standards. The idea being this is an emergency situation. I think in my interpretation, it seemed like the statute was designed to address issues like natural disasters and that sort of thing. It was sort of being used, I think, in a unique way for the homeless emergency aid program around a housing crisis. But nevertheless, multiple jurisdictions made that declaration across the state, including 3 in San Joaquin County.
Got it. Okay. Well, I'll look forward to finding out a little bit more information on it. Thank you.
Thank you. Supervisor Elliott?
Thank you, Chair. Of this 414 people who are on the current list, are all of these over age 65?
This list goes down to 55. So the idea being that if for some reason the person at the top of the list cannot go into the facility, then you go down the list. So the idea being to have a relatively long list to ensure that we can keep going down that list until we have the facility full.
Right, and then you say that age isn't the only requirement on that. Do you also have some kind of a weighted scale there for other types of high risk?
Yes, and that's very much about what we might say an on-the-ground assessment of individuals. There is an additional list that the HMIS provided, Project Room Key, that is 39 individuals who have already been assessed by community medical centers. Those individuals are currently living at either Stockton Shelter for the Homeless or Gospel Center Rescue Mission. So that list is separated out because these are the individuals that have been looked at by CareLink and are already deemed high risk for whatever reason, and that information was not provided to me in terms of specifics But certainly we have a list right now that I think will grow as the week progresses.
And they're part of this 414 person list as well?
Yes.
Yeah. Okay. So has there been much testing done among the homeless population?
Not as yet.
Okay, so we really don't know whether there are people that are positive in it. Yeah.
That's correct. Yeah, as Director Woods mentioned, I certainly once testing begins in earnest, I think we'll see a change to that situation.
Okay, and then if we can't put people who test positive into some type of a hotel, motel, whatever, then what will we do with them?
So it's an excellent question, one that we have struggled with, obviously, over the last several weeks. As Director Woods had mentioned, Motel 6, initially, as we understood it here in San Joaquin County, was going to be available for COVID-positive folks. That ended up not being true. There are a couple of options that Assistant Director David Tolliver are currently working on. There's also an option that Director Woods is working on in terms of finding places for folks who are COVID positive. Those negotiations are ongoing, and so the hope is that we have something to bring back to this board very soon regarding some better options.
Okay, and then on these costs to restore the hotel to its current condition, since we don't know what it will cost, is there some kind of a cap on that, or do we have any type of insurance coverage that can limit our liability on that?
If I could, I don't believe David Tolliver is probably available yet, but if we could ask counsel.
We have tried to negotiate limitations on the liability. I know that was a point of contention to try and cap both our exposure for damages to the facility. In other words, to try and put a cap on what we would spend to refurbish the facility or repair any damages, as well as trying to cap our liability for injury to third parties and indemnification. I know that was part of the lengthy negotiations that went into this agreement.
Hi, this is David, if you can hear me.
Yes.
Again, David Tolliver, Assistant Director, General Services. Good morning, Chair Miller, members of the board. Two other, if I can compliment what County Council has said about limiting exposure. We've limited the time of the agreement to June 30th, and we would want to end the agreement at the soonest possible time. If the agreement went to, say, December 31st or a much longer term, we would anticipate more damage, and so limiting the time is an important factor. The other item that we've done is we've had a system of checks and balances developed, a combination of county staff, Motel 6 staff doing daily room checks and checking on the guests, and should any misbehavior be detected, we'd be able to catch that at the soonest possible time, and if it warranted, we would be able to remove guests. The reality is we are responsible for county guest conduct, and that's and county council has spoken to some of the risks there.
Okay, so that pretty much answered my next question then. So I see that we're providing daily check-in calls. So checking for what? Just personal well-being, but it sounds like we'll also be checking to see the status of the room and to ensure that damage isn't being done and that sort of thing.
Yeah, so one of the elements that ended up in the final agreement was a daily in-person check of each room. So county staff will be responsible for doing that. A part of it is one, taking the place of daily calls, but just, to check in on the well-being of the guest. But also to put eyes on the room and see if there's any issues that we can address early on that may be causing damage to the room or other concerns. So there's that aspect, as well as on-site security 24 hours a day. The agreement provides for 2 guards on site, and that's really to ensure that we don't have visitors coming to the property, and this does not need to be a place where visitors are residing. Those are sort of some of the risk mitigation issues that we're trying to put in place to ensure that we don't have additional liability.
Okay, and then are those people who are residing there able to really come and go as they please? How or will there be any type of restrictions on that?
You ask a very good question, and this is, we posed this question. We posed a question to the state just yesterday, and the reason I asked is because in a perfect world we would ask guests not to leave at all, and then I know that we will bring in guests, and it's a voluntary placement, but there are guests that will certainly be in need of cigarettes, for example, and I'm not in the position of wanting to use public money to provide cigarettes, obviously. So I think there will have to be an opportunity for folks to leave. I would like to do that in a controlled manner and for a window, because the expectation is that these folks are staying at this hotel for isolation capacity. And if we let them leave and saunter around the neighborhood on their own, it sort of defeats the purpose of that isolation capacity. So I think we're working through our programming. I think we're going to have to learn as we go and be nimble, put policies in place to ensure that folks are staying at the property as much as possible. So I know that doesn't give you a perfect response, but in one of the things that we've contemplated in our procedures is a window of time, perhaps between 2 and 4, where we would allow guests to leave and then return. And just being practical, they could go to a store and get their cigarettes and return, or any other personal need items that they have. The county is not providing.
All right. Thank you. So it sounds then that we're not dipping into any county funds for this. This money is all coming from SB 89?
That's correct. And this budget does not presume that there is any FEMA reimbursement coming down the line. Our intention is to utilize SB 89 funding from COC, the county, as well as the city contribution in proportionate shares for the expenses, and not presume that there's any FEMA eligibility down the road. If there is FEMA eligibility, we will have procedures in place to track costs and to ensure that our costs are FEMA eligible.
Okay, and then so we're saying that this program is worth the expense to preclude the possibility that we could have an outbreak among the homeless and overburden the hospital situation. I mean, we're still looking at keeping the curve flat. Is that basically the rationale for this?
That is the rationale. That's the rationale presented to us by the state. The state has said that this non-congregate shelter is the best methodology for protecting homeless, vulnerable adults.
Thank you.
Supervisor Wynn?
Yeah, real quick. Supervisor Patty and Supervisor Elliott raised good issues. I'm assuming that we're going to have certain guidelines for the occupants of these rooms. As far as smoking, I think most hotels prohibit smoking in rooms, which, and I guess going to Supervisor Patty's concerns, if you smoke in a room, it has to be totally changed, probably carpeting, painting, those types of things, because it's very hard to get rid of that odor, and I'm sure Motel 6 wants to rent these rooms out in the future after this particular project is complete. So not just that, Supervisor Elliott raises the question, so I'm assuming there's going to be a list of rules that the occupants will have to adhere to, that will the security guards enforce these rules, or will it be county staff? In other words, I guess this isn't a free-flowing thing that, it's just we're providing the facility and they can do what they want. There are certain restrictions, as they are already following at the shelters, to maintain their presence in these particular rooms themselves, correct?
Exactly. So as part of our welcome packet, there will be rules for residing at the hotel, and there will be consequences if they don't follow those rules. It's a voluntary placement that we're providing to individuals. And in terms of smoking, I mean, one of the attributes of any property that we were looking for was for doors that open to the exterior, not into a hallway, with the expectation that folks could step out, catch, ironically, some fresh air while they smoke their cigarettes or whatever. But
Great. Thank you.
Thank you. I know you talked a little bit about the cost share on this. Can you just break out real briefly the amount that each entity is contributing for this? And then in terms of the potential liability going forward with restoring rooms or property, is there an equal pledge of cost share from the three entities, or does the open-ended liability fall exclusively on the county?
well, frankly, I will start from the end of your question. Frankly, there have not been any discussions with the city in terms of restoring property and the cost to do so. At this point, I would represent to this board that it will be entirely county cost, absent some sort of approval after this meeting, if this is approved. In terms of the contributions to this project, the COC contributed $102,547, representing 8.3% of total available funding for this project. The county has presented $471,729, which is the entirety of the SB 89 funding has been made available for this project. That represents 38.5% of the project. And the city has, they received, I think, in the neighborhood of $1.2 million of that amount. They've contributed or made available $650,000, which would be approximately 53% of total revenues available for this project. And that was our intention, to use that percentage basis for charging each funding source for this project, for the ongoing lease as well as the supportive services.
Okay, thank you. Supervisor Elliott, follow-up question?
Thank you. Yes, one additional question on liability. Now, if some crime occurs on the premises here, does the county have any additional liability for that? I mean, just for an example, there was a report of a fatal stabbing near a homeless shelter here recently, apparently over a fight over some donated goods. So since we are making this premises available, are we liable for something that may happen there in that regard?
I don't think that we're necessarily liable based, just generally, as we often say, anybody in this today's society, anybody can sue anybody for just about anything. So were something to happen at the property, is there the opportunity or the possibility that the county could be sued? Yes, that's possible. But whether we can be sued and whether we would be necessarily liable are two different things. I believe that this agreement puts in place a number of elements that limits any liability that we might have, including having the security there 24/7.
Thank you.
So I just want to double back real quickly on potential costs to restore the property. If it ends up that the city and the COC do not have additional funds or choose not to contribute to restoration of the property, are there any other sources of funding for the county to tap into to cover those costs, or where would the money for that restoration? I mean, if we have 70 some rooms, let's say it costs, we have to restore half of them. Where does that money come from? Do we have a source identified?
So the SB 89 funding is not available for that.
Correct.
And I've heard estimates thrown around that a room could be $10,000 to repair. So if you're talking about 38 rooms, that certainly gets very expensive very quickly. And I think the only source of funds that would be available to, at least to the county, would be county general fund.
Okay.
So, Madam Chair, last week we received our county allocation of CARES Act funds, and we will be bringing before this board probably at the May 12th or May 5th board meeting to get some direction, but also recommend the way it can be used, because the U.S. Treasury was very deliberate on what those funds are available for, and they're COVID related, and those funds are only allowed through the end of December. And so we're going to look, I'm sitting here thinking that this is, and I thought about it last week also, and didn't get an opportunity to reach out to Director Woods, that I would look there first for to utilize a portion of those funds for restoration, because this county would not be taking a leadership role in this effort if it wasn't as a result of COVID. Because as Mr. Wood said, this room key funding became available as a result of COVID. So I think this purpose, especially from a restoration perspective and risk that the county has taken on, but we will first ask both the COC and the City of Stockton if they are willing to proportionally share with us that risk. But I would look there first to make sure that their eligible costs, our county auditor controller is a part of the team, because there will be strict audit rules and requirements that the CARES Act money is eligible for. So we'll make sure if it does qualify, we will make sure that we use that pot of money. And say, for instance, if the COC and the City of Stockton are not willing to share in that liability, then we will be covering 100% of it. Hopefully the CARES Act. If not, Director Woods did say, and he did say it correctly, it would be on the county's general fund.
That's where I was going, was on the CARES Act. I was hoping that this might be something that would be eligible under that funding. So since it is very specifically COVID related, I would hope that we would pursue that aggressively, given the relaxation on a lot of property tax collection by the state. I share the concern with the rest of this board that the county's general fund may not be in a position to underwrite the full cost of this. So anywhere else we can find some revenue that could be applied, and hopefully we won't need that amount, but I think we do have to be prudent, and I think there are other counties that got into this much earlier than we did. They jumped in very quickly. And I think we can look there for some guidelines as to what we might expect in the way of costs, back-end costs on this program. So I hope that we will definitely pursue that and look for that first as a revenue source. Supervisor Patty?
Thank you, Madam Chair. Couple quick follow-ups as expressed by this board and the concerns. Is there any thought, and just a general question, any thought about taking out an insurance policy on that property so that any exposure that we have as it relates to damages or assaults, property or personal damages, it might behoove us to have a policy in place as insurance? Anybody looked into that?
Go ahead.
Oh, I'm probably actually going to. So I do believe that the county, in terms of if the place was completely destroyed, the county would be responsible for the first $25,000. And then beyond that, our excess insurance authority has agreed to cover that property for the duration of this agreement. And I can validate that for me, Ms. Nino.
So that is my understanding also, but I was curious, Mr. Tolliver, did you speak with risk management in that regard and confirm, since this is essentially a county lease, but we don't own the property and it's being used for a different purpose? Have you validated that with risk management?
Yes, this is David. Yes, I have spoken with risk management, and it is, as you stated, yes, the lease agreement is solely with Motel 6, and the policy would be $25,000 coverage per occurrence per incident. And so, if there was a fire, for example, and total replacement costs were needed, the county contribution would be $25,000, as an example.
But did you confirm, because essentially it has a risk for the county on a per room basis?
So this is a complexity. The way the insurance is structured with the county is it's per incidence or per occurrence, and so we would try to separate out wear and tear versus an incident where a room required remodel. So if there was an incident where a room was destroyed and we identified that specifically, that would be covered under the $25,000 per occurrence liability. However, wear and tear would be something we'd have to negotiate with the insurance company, and it might be something that we may have to cover. It's an unknown. There are many unknowns, and it's just part of the risk component as insurance companies haven't done this sort of agreement before, and so that's part of the risk component that we're attempting to address here.
So as a follow-up then, could we look at an additional rider to any policy we have that's specific to not per incident, but just for a property and for personal and property damages?
We will follow up on that, Supervisor Patty.
Okay, and then also, if we're 70 rooms, are we looking at double occupancy, or is it single occupancy, or is this possibly either or?
So this would be single occupancy to provide that isolation capacity. But for example, if there was a couple, they could certainly reside in the same room because they are already exposed to each other.
Sure. Okay. And then I think lastly, are we going to have, as mentioned, when it relates to smoking and there's a vast range of people that are finding themselves in the conditions that they are out, living out homeless. So on the spectrum of, least worst to worst, are we kind of filtering who would be coming in and having a screening process that when we're bringing somebody in, they're not on the furthest extreme of the spectrum and perhaps most likely to be problematic?
It's a great question, Supervisor. So, as is always the case with these things, the referral process will rely to a great extent on the assessment of individual case managers at the originating organizations. So, for example, if someone is being referred from Stockton Shelter for the Homeless, a conversation needs to happen between HSA staff and the case manager who's been working with that individual. And so the assessment of the case manager will be paramount in terms of their belief that this person is quote unquote right for this project, whatever that ends up meaning. I will give an example of my time at Stockton Shelter for the Homeless, where we had some funds from the county that we were able to use for a voucher program for winter shelter. So as things expanded, we were able to put families into motels. Ironically, we used the location that we're talking about today. It was the only location in Stockton that would allow us to do this. We were extremely cautious as an organization about placing the correct people, whatever that means, in that environment so that we would not damage that relationship, knowing that we couldn't find that elsewhere. So there's a lot of experience with case management staff, and this is true at Gospel Center Rescue Mission and Lodi Shelter, Hope Harbor, and everywhere. These folks work day in, day out with these homeless individuals, get to know them very well, and will certainly be able to provide and would be expected to provide that kind of assessment and information to HSA staff to say, we don't think that this person is necessarily going to be a good fit. So yes, absolutely, we're going to be relying on our partner organizations to help us make those assessments and get the right person in there up front to hopefully mitigate as much as possible and to the extent that it's possible any problems, damages, liability, et cetera.
Excellent. Glad to hear that. And I also would suggest that, I think to Supervisor Wynn's point, maybe we put together guidelines of, no smoking in rooms, no this, whatever provisions and structures that we'd want them to, no damage to the furniture, no this, no that, no, whatever. We want to have a safe operation, not to damage that relationship in order to damage the properties. We want to have those that understand their responsibility and are willing to accept the terms of utilizing the rooms as offered.
And I will say and just add that 400 plus individuals that we're looking at right now, and certainly the need is even greater. It should be relatively easy, frankly, to find those individuals that will be a good fit for the 76 rooms that we have to offer.
Excellent. And the only thing I would further volunteer is there maybe even be an opportunity for double occupancy to help more people.
Understood. Yes, absolutely. You're correct.
Two people that may not be related, they may both be negative on COVID-19, but they're willing to share a room with double beds, and that possibility may exist, that just to help more people.
And again, case management staff at the originating organizations can help with those sorts of connections, understanding the relationships that already exist. You certainly don't want to put two folks who are, enemies in the same room, but there's an understanding there when you work with these folks day in and day out.
Yeah, whatever we can do to help the most amount of people and the efforts that are being taken is fantastic. So thank you for answering the questions from me.
Thank you.
Thank you. Supervisor Elliott?
Thank you, Chair. One last question. So we've been talking about the liability for any damages and restoration of the rooms. And since the City of Stockton isn't really a party to the agreement itself, what kind of conversations have we had with them about their part in restoring the premises to the as occupied position?
As of this point, there have been no conversations regarding their liability for that expense.
Right. Well, I noticed that we did get a letter of support from the mayor recommending that we approve this project. So I think we should respond to his letter and saying we appreciate your interest in this, and we would also expect your participation in any damage restoration that occurs as a result of this project as well.
Understood. And I would like to add that this has been an exhaustive search to bring us to this point, and has required a lot of partners at the table. And I would also share that I appreciate the city contributing $650,000 to this effort, and in fact, the city could go stand up their own project should they desire. And I think that with the work and the partnership that has gone on to this point, I would hope and expect that the city would be willing to partner with us on the back end of this project as well.
Sure, it would just make sense to do that.
Sure.
And perhaps a percentage of responsibility could be worked out in conjunction with the percentage of revenue contribution to it as well.
Absolutely. We're planning for success and expecting contingencies on the end.
Right. Thank you.
Excellent. Thank you so much for all the good information. It's my hope as well that we will learn a lot through this process, that we may develop some insights into how an ongoing program could work in collaboration with our partners and funding sources and that sort of thing. This is a learning experience for all of us. So I appreciate all the commitment that's gone into this to date. I know it's been very difficult and very complicated, and we'll look forward to some regular updates once the program is up next week. And I know the board, and I'm sure all our other partners, the COC and the City of Stockton, and our other cities as well, will be looking forward to hearing how things are going. So thank you very much. So this is a consent item, and I'm looking for a motion and a second.
I make that motion to approve this.
Second.
Okay, we have a motion and a second. Please cast your votes.
Madam Chair, if I could clarify, that's for both consent items, is that correct? The motion?
Well, would you?
Consent agenda, yes.
Yeah, the consent agenda is broken out into this general government item and also health and human services. So would you like two separate motions, council, or just one is okay?
One's sufficient.
Okay. And so your motion is for both items?
Motion to approve consent items. Thank you.
Second? All right. And did we receive any comments during that conversation?
No.
Okay, thank you. So please cast your votes on both items. Thank you. Consent is approved 5-0. So next up is our discussion item for general government, which is specifically on COVID-19. This is our special meeting to receive briefings and updates. So I think I'm going to ask County Council to kick us off. Week, Mr. Miles?
Thank you, Madam Chair. We wanted to provide an update on the amended order that was published on Friday. The amended order addresses 3 areas: faith-based services, outdoor activities, and then some clarifications on certain business activities. On faith-based services, late in the week of April 17th, the State Attorney General filed an opposition in the Gish case. Gish is a case that was filed in San Bernardino or Riverside County that challenges the state home order of the state as well as of the county, and it challenged it based on infringing First Amendment rights on a religious basis. And in that opposition to the motion for preliminary injunction, the State Attorney General said that faith-based services could be presented in a drive-in-like manner, provided that social distancing protocols were observed, because that fell within the essential workers list that says that faith-based services can be provided through streaming or other technologies. So they were construing the drive-in-like manner as other technologies. When we became aware of that, or I became aware of that early on the week of the 20th, or on or about the 20th, and at that time communicated with Dr. Park and Public Health about the appropriateness of amending our order so that we were consistent with the state's directive as it had been, or our state's explanation as it had provided in that opposition. So we began working on the modifications at that time. The amended order allows for faith-based services in addition to streaming and the ability to provide that service, or means through that service, to meet in a drive-in-like manner, provided that all activity occurs outdoors, all persons attending must be inside a motor vehicle occupied by persons from the same household, all motor vehicles must maintain a 6-foot interval, all persons must remain in the vehicle they arrive in, no tangible items of any kind, including food products, may be transferred to persons in motor vehicles. Up to 5 people may enter the facility as necessary to put on the presentation, and all other social distancing protocols must be complied with. Originally, the order did say, as was mentioned in the comment this morning, did require that windows be up on the vehicles. After it was published, we had further conversation about that. Dr. Park reviewed that and determined that it wasn't necessary at this time, and so struck that from the order and then the amended order, or then the corrected order was put out on OES website and I believe on the public health website. The amended order also addressed outdoor activities, allowed that golf courses could resume limited operations, provided again that certain requirements were met to protect the employees, the golfers, and the public. And then the order provided clarification on the circumstances under which realtors could conduct in-person showings of a home or residence, and also provided guidance on social distancing protocols to landscapers and gardeners. Through all of this, and as we look to activities in the future and requests that we continue to receive about this activity or that type of business and whether or not it's allowed, we are looking to the state for guidance on that. The state has a essential business inquiry email address that inquiries can be sent to, and so that just became available late last week. And so new inquiries that we receive, if it's not clear from the order, we are sending those up to the state to get their clearance and guidance as we move forward.
Okay, thank you. Any questions for Mr. Miles? I'm going to ask Dr. Park to come down for her update, and also if she has any additional comments on the revised order or what we're continuing to look at, but we're looking forward to your update, Dr. Park.
Thank you. So our current case count stands at 535 confirmed cases with 25 deaths. Our case count continues to climb, but our most significant metric is the number of hospitalizations. As I've said before, this is the most accurate barometer of the effect of mitigation, and the entire reason why we've all been sheltering at home and social distancing is the data that we look at when we talk about flattening the curve. It's the hospitalization rate. So it's very encouraging that despite the fact that we have continued increase in number of confirmed cases, our hospitalization rates remain flat overall. So I do have a graph to show you. And I apologize that this is so small. I don't know if supervisors, if you have it on your screen. So if you could zoom in and out, I don't think I have the capability to do that here, but on the left side is the number of confirmed cases from the beginning, tracked daily, and it goes by case count, and so as you go down the list, you can see that the number obviously gets bigger as we get more and more cases, and then we're looking at the percentage of increase on a day-to-day basis when we're looking at that table. The table just right of that is the hospitalization percentage change. So you're looking again as you go down the dates at the number of people cumulatively who have been in hospitals. And what we're focusing on now is that percent change, which is the most right-hand column. And so we see that in the last maybe 5 or 6 days, if you really look, that we are running flat, which is very good news. And it's also demonstrated in the graph where, again, as we have shown you before, the red line is our real number of cumulative hospitalizations. People have been hospitalized from the beginning of the COVID crisis to now. And the green line was that flattened curve projection that was made for our county. To be very clear, this is the cumulative number of hospitalizations for our county, including people who are hospitalized outside the county, so might not be an accurate reflection of the hospitalizations in our 7 area hospitals over time, but all of the people who are residents of San Joaquin County. If we were to take out some of those numbers from people who have been hospitalized outside of the county, the burden to the county is actually even less, and the red line is probably crossing that green line. So I want to thank the residents of San Joaquin County for this curve, because the sacrifices and the efforts they've made, without a doubt, have saved lives and protected our vulnerable citizens. I am very certain of that. And I do ask and plead for their patience, because we're not done with this fight against COVID. We need to remain vigilant with what we're doing. I understand that we all want to go back to normal, but even when we do go back, it will be a new normal, and you will see people still practicing social distancing and probably wearing their face coverings and washing their hands more frequently than we were before. So we are looking at ways to gradually resume activities in a manner that doesn't put people at risk or that lowers the risk as much as possible. And I will continue to look at data such as the numbers I've just shown you to guide the tempo at which we move forward. So there is something from Resolve to Save Lives, and this is easily searchable online, a table of things that we would use on when to reopen and how to reopen based on epidemiological factors, healthcare factors, and public health factors. And Resolve to Save Lives also has a table on when we would close some of those things again if we had to. And so those are mitigation measures that would strictly need to be followed according to this group, again separated in an epidemiology column, a healthcare column, and a public health column. So things such as increasing case counts of at least 10% over 3 consecutive days, that might be a trigger to consider restricting, putting restrictions back in place, or an inability of healthcare to deal with ICU patients, or public health not being able to do sufficient contact tracing. So if you look at this table, and it's, as I said, available online, it's very exact as to what we would follow to put restrictions back in place. I am looking at also a 3-day moving average, and going to be looking at consecutive 3-day moving averages to see if we need to reinstitute some restrictions. I'm hoping that as we move along, that consecutively we don't go up by 2 or 3% over 2 cycles. If we do, that would be cause for concern. I'm really, really hoping that we're able to continue moving forward. And so I need all the residents of this county to bear down and continue with the efforts, talk to their neighbors and friends who are not social distancing, and really have the community see that this is a community-wide effort, because we want to move from one phase to another as quickly as possible. My understanding is that Governor Newsom is going to be discussing in his press release today a California recovery plan. As you know, he has his own economic task force working on this plan. And this was briefly shared with county health officers on a phone call Saturday. And so I have some examples, but I don't have this in writing as a document from the state. But what was shared with us is that there will be a 4-phase recovery plan, starting with phase 1, which is the phase we're in right now. It is the current stage in which we're trying to build up infrastructure within the public health system, create safe ways for essential workforce to remain at work, and making sure that communities have what they need to stay home, such as our elderly citizens, wraparound services to make sure that they're safe at home. The second phase is the phase that we will need to gateway into, and this is a modification phase that aims to get more people back to work, making safety adaptations for things such as schools, daycares, and businesses. I don't believe that's to say that we will be reopening schools when we open into phase 2, but that we are getting them ready for the eventual opening and making sure that they are making safety adaptations. Phase 2 includes the reopening of limited retail to business sectors that represent lower risk categories. And some examples that were shared with us were car washes, pet groomers, and non-contact personal health services. Phase 2 also includes the soft opening of public spaces. So this is, like example, the beaches that we're seeing where people are allowed to walk through but not to stand or settle down and congregate. Stage 3 would be further modifications to allow for higher risk sectors to now open up. It would return a greater proportion of the workforce, and basically the remainder of the workforce would be returned to work. This would involve some statewide surveillance, and at this point, contact tracing would really have to be heavily in place and felt to be safe and adequate for moving forward. Phase 3 involves such things as higher education, bars, hair and nail salons, entertainment venues, youth sports, and religious services that could be held in person. So this is a huge move from stage 2 to 3, and knowing that it's a huge move, the counties are really being asked to reflect on their own surge, on their own ability to continually supply PPE to hospitals with an understanding of your regional numbers, and it does allow for some regional variation. So just as the state has partnered up with 4 other states and they've made a Western Pact to move together, even within the state of California, there are regional counties that are making pacts to move together. And what I do know is that there are some rural counties that have hardly any COVID and haven't had any new cases for weeks. They are pushing to move forward. And so the tempo at which everyone moves forward will be different. The way that I would like to move forward would be to stay in line with the governor's plan conceptually as far as what would be included in phase 2, what would be included in phase 3, and what would be included in phase 4. But there is room for variation. And so I would like to be open to perhaps moving at a faster tempo than even the governor if we are ready. Stage 4 is the full lifting of all restrictions. So this would include concerts, convention centers, and large-scale sporting events. So that would obviously be a return to complete normal, and that could be many months from now. As the governor said in his press conference yesterday, he's unveiling this plan today publicly, and he stressed that people have patience because we're moving in terms of weeks and not months. So I believe he's hinting at something moving between stage 1 and 2 within weeks. And so that's what I'm hoping for, and that really aligns with what we've been discussing locally here as far as our next stage of reopening. As I said, we have to rely on the residents of this county to determine how we move. There are many counties that are trying to move ahead of the governor, and basically the message they're receiving is, if you have the capacity, if you have the surge planning, if you have the contact tracing and isolation capabilities, if you have the flattening of the curve and you're going to continue and promise to monitor to continue the curve, you might on your own try to move forward. And it is my goal to get to that point where we're in stage 3 and we're opening up hair and nail salons and all the things that people are wanting and writing to me about. I would love to move smoothly from stage 1 to 2 to 3. Obviously, this means that everyone needs to continue to do their best at staying their distance away from other people, washing their hands, and as much as they can, stay at home if they can. So public health is receiving complaints that as we did lift some restrictions last Friday, people are sending us pictures of people not social distancing. And so that's my concern. And, you know, the governor expressed his concern about Newport Beach and all the people crowding on the beach yesterday. He made it a point to say that that was a big no-no. And so countywide, I need to say the same thing to our residents. We may have lifted some restrictions on some things, but please, please continue to distance as much as you possibly can, even in those spaces that we've allowed. I don't know if there are any questions at this point. Maybe I'll stop here.
Any questions for Dr. Park? Supervisor Patty?
Thank you, Madam Chair. Thank you for the report, a good update, and I appreciate your eyes on the ball of what we're doing and where we're going, and I know we're being as progressive as possible in the county. When you mention contact tracing, can you maybe identify what's contact tracing mean?
So this is something that is not new to public health. We do it all the time, like in tuberculosis. It means that you find who you learn of somebody who is positive for TB or COVID, for example, and then you go back and take a history and trace back where they've been in the last several days or 7 days or 14 days, whatever you choose, and you then ask, who have you possibly exposed? Try to find the exposures. ask about their symptoms, get them tested if you feel it's necessary, and quarantine them. So it's a large effort, and it takes a lot of bodies to do that, especially with COVID. It's going to take a huge effort nationally.
So I'm a little bit concerned about that. Based on what we're seeing in the new modeling is that there's a lot more people that have exposure than we originally believed to be, and the morbidity rate is much lower. So, I mean, for us to find out, and as we see in our own testing, it's going up in 500 plus. I mean, do we think we're going to actually be able to contact trace every person they've been? I don't care what Google or Facebook does, but do you think we're going to be able to track every place they've been, every person they've been to, every person that person's been exposed to, and test everybody along the way? I could just see a cavalcade and a challenge that would be impossible to meet once we find this is far more pervasive than we originally had believed, as recent studies have indicated. What's your feeling on modifying that approach? And I know this is coming from the governor down to us. So what's your feeling on that? And how can discussions modify perhaps that approach?
So this is coming from the governor, and it's even coming from the president's task force. So this is one of the governor's 6 indicators. It's the first indicator where you want to do widespread testing, contact tracing, isolation, and quarantine. And it is quite a challenge. If you see our numbers going up by 20 to 25 cases a day, that's 20 to 25 people you then need to call, find out where they are, and find out where they've been. So we are definitely needing to build up our contact tracing capacity here locally, as we don't have a strong enough or large enough workforce here locally at Public Health. So we have made a formal request for 30 additional staff and for an alternate site to work. We don't actually have the infrastructure at our building on Hazelton or the space for those 30 additional staff, so that's something that we're working on and will be rolling out soon. And we will need to train those additional staff to do the contact tracing, but it is happening. It's a work in progress.
So when we have 500 plus people that have tested positive through our testing process, we're doing contact tracing for all of them and quarantining all of them?
Yes. It is a challenge, as I said. And it won't be the 500 because that's our total case number so far, and some of those people are already through with their isolation period. We've monitored them through their 14 days of isolation, and they're done. It will be the new cases as they come in daily.
So have you, I know last time, a week ago, we talked about the Stanford and the USC study, and there's another follow-up study out of New York, all indicating that this is far more pervasive than originally thought. And so with that understanding, if we think we're going to start isolating, what I think New York had was it a 25 or 30% of the population actually were positive with COVID-19, and to start trying to contact trace all of them and where it goes, I mean, there's no end in sight, in my opinion, versus just isolating and maybe, as you had noted, recommending those that maybe are at high risk need to protect themselves and take on that responsibility versus penalize and quarantine more people as we discover this is, again, more pervasive throughout the community than originally believed.
So, yes, the studies show what we already presumed, which is that there are more positives than we could possibly have tested in the beginning of this crisis. So the percentages are showing us 20-30% of people in the general population may have had COVID at one point and may have antibodies through serology testing. That's still not enough to confer immunity. So the problem is that you need 50 to 60% of your population to reach herd immunity and to say that the community at large is protected. And so although it shows that, yes, we have higher incidences of COVID-19 cases, and perhaps that will drive the mortality rate down as the denominator enlarges. It's still not enough to confer herd immunity, and there's still some research pending as to whether even being antibody positive means that you are immune. So we're not certain that having the antibody means that you have full immunity.
I mean, as we talk about the economic impacts of this, and to get from stage 1 to 2, which I know that you're keeping your eye on, and you've got some levity. That's correct, to do it maybe independent of what the governors they're giving each county.
I believe moving from stage 1 to 2, we're going to be in line with the state. I'm anxiously waiting to see what he's going to say today. but the time frame that he seems to be suggesting moves along with the time frame that we are thinking of locally. Stage 2 to 3 will be, I think, a bigger challenge.
So when you say weeks, are we within 2 to 3 weeks or 6 to 8 weeks?
I would like to think 2 to 3 weeks, but again, I'm looking at our numbers. So as restrictions were lifted on Friday, I don't think the numbers are going to increase as a consequence of what happened on Friday right now. So in a couple of weeks, I'll know better if there were any consequences to that. And around that time, if our curve is still looking as flat as it is, then we will be ready to move.
Understood. And you had mentioned that somebody shared some photos, and I have no idea where the photos were. People were not social distancing, but if it's related to any of the operations, as you know, I've taken a front and center role in working with the golf courses. So if anything comes to your attention, I'm working with. I get daily calls and interactions with the general managers. So if you have any insight of what they need to do different or better, please let me know, and I could immediately let them know that there's an oversight on your on their facility.
Excellent, thank you.
I appreciate that. That's all for now. Thank you.
Supervisor Elliott?
Thank you, Chair. Yes, over the weekend, I also participated in a call. I guess it was the day after the call that you were referencing, where they had a call that included members of the CSAC Executive Committee and certain other committees. I think the Executive Officers Association was represented there as well. They presented perhaps some slightly different slants and approaches on some of these things. But one of the things that I found very interesting was that they were looking at less emphasis as we're moving forward on what's considered essential versus non-essential, and transitioning into the idea of what is less risk versus higher risk in terms of the transition process into opening things. So I guess we'll see more when the governor actually rolls out the plan as to what he's got in mind. But I think that's positive as well if we look at it from that perspective. So I'm glad to see that we've made some adjustments to our order, the order that we adjusted last Friday. And I just think we need to continue to look for ways to open up businesses and get people back to work. And it sounds like that you share that goal as well. As long as we do it in a way that protects the customers and the employees from increased risks. So just some things I'd like to toss out there as examples of things that we could look at here that would provide rather low risk. Things like drive-through car washes seem to have very little propensity for congregations of people. They're sort of innately social distanced. And then perhaps we can take this idea of drive up and drive through services a little further to have to apply that to retail operations as well. Perhaps some drive up or front door retail operations. And then I passed on to you as well a list of guidelines and suggestions that came from the Christian Law Association, just some guidelines that they had put out to various churches as to steps that they could take to reopen for religious services that could actually be conducted indoors in a responsible manner. So I think all of those things that where people are actually looking at ways to reopen for business in a manner that is safe and creates less risk. I think we should look at all of those and try to take advantage of the opportunities there to get people back to work, get people back into the types of activities that bring normalcy back to their lives and are healthy for them. One thing I would like to just bring up here, we've had a call to the office that reported seeing people selling food out of their cars and produce and even prepared foods out of their cars. And when those folks were approached to see if they had a permit to do that, well, they apparently did not. So I'm just wondering if we're tracking that kind of activity as well, because that would seem to be things that, if we're particularly lax on that, that could promote the spread of coronavirus if we're not really looking at that type of thing.
So your first point about looking at things on a risk scale versus thinking of things in terms of essential versus non-essential, that was actually pushed by the health officers on our Saturday call. We really pushed the state to stop saying that people are non-essential, because everyone's essential to somebody, and can we please start looking at this in terms of risk? So that is probably why on your call they were speaking in those terms. I appreciate all of the letters that I'm receiving and that you all are forwarding to me. A lot of businesses are definitely becoming very creative with the way that they want to entertain the social distancing and how they want to implement measures to make it more acceptable. And I am looking at those. I still would like to follow conceptually the phases as the governor is laying out as far as what types of businesses will be opened first. So moving from stage 2 to 3 to 4, we might be on a separate timeline by a little, but I still think conceptually I would like to move in regards to the types of businesses that the state has deemed lower, medium, and then high. As far as the food being sold from cars, I'm not sure, Mr. Miles, if I'm not in charge of looking at their licensing. I know that food is essential, ag is essential, distribution of food is essential, but I don't look at whether we're checking to see if they're licensed or not. That's not under public health authority.
Likely that falls under environmental health's.
All right, we'll forward that over to environmental health as well. Yeah.
Thank you. Supervisor Wynn?
Thank you, Madam Chair. Thank you, Dr. Park, for your openness and willingness to be flexible in regards to a lot of these issues. It is complicated. I think the biggest problem is because this is all brand new, especially by the overwhelming coverage of New York, which has created a tremendous amount of fear in our population from coast to coast. I think sometimes we have a tendency, I say we collectively, to maybe overreact. A couple of things. One is I appreciate what the governor's doing and certainly his task force. However, I would submit that in my experience with the Sustainable Groundwater Management Act, which was brand new in 2014, which hit us in 2015, in dealing with Department of Water Resources on a monthly basis at our meetings, frankly, they didn't have a clue. They had no idea. The legislation was passed, but they had no way of understanding how it would be implemented other than very generically. And I appreciate their efforts because they did attend every meeting we had over the last 5 years, and their contributions as far as thoughts by questioning our questions, and I think also the action of the board in regards to how to address this and what would be the most practical ways, I think was very productive in that collaboration. So I understand your willingness to work with the state. The other part of it, though, is that I think sometimes, and I speak at the national level, and I only talk about this generically, oftentimes there's a lot of decisions made from individuals who aren't kind of in the trenches like you are, and certainly businesses, whether they be large or small, it makes no difference. They're all impacted the same way. And so sometimes I think and I don't want to say one size fits all because I know that we're looking at it differently, but there is a tendency to kind of generalize oftentimes. And I appreciate your willingness to look outside the box, so to speak, and make differentiations for this county. When we talk about as Supervisor Elliott talks about the food sales, we have roadside food sales for years. I mean, that's a daily occurrence. You can drive anywhere in this county today, and it's been there. And frankly, the reason it happens is because the county doesn't enforce it. And whether it be the sheriff, and I'm not pointing fingers, this is just the reality, but whether it be environmental health or sheriff's department or whatever, it just has been overlooked, and farmers complain, vehemently because those particular vendors are not following the old rules and regulations that farmers are, as far as rest breaks, as far as water, as far as covering and those things. So maybe it's something, and I appreciate Supervisor bringing it up, maybe it's something we need to address for the public health, and not knowing where a lot of vegetables come from Watsonville and places like that, and not from our county. So that's a good point. The other part that we've talked about is government's solution to most problems is to regulate, to oversee and make restrictions. And I have a problem with that, because I think government is really a partnership with the public and businesses in regards to solving problems, which I think you're doing. However, we are seeing a loss of control, so to speak. I hate to use that term, but I was reading a study of 100 million cell phones in the United States, and essentially what they were looking at is tracking the traveling of those cell phones by individuals. And interestingly enough, on a nationwide average, they're looking to see how many people are actually abiding by the stay-at-home. It was 33%. It's going down to 31%, and the trend is going even farther. I'm surprised that over 60% of individuals are not in the testing model to make sure that we're not talking about people going for walks or bike riding. It has to be at least a mile, and there's certain criteria to make sure it's somebody traveling away from their home for a distance. More and more people are becoming basically having quarantine fatigue. When you talk about identifying somebody like the contract tracing that Supervisor Patty alluded to, the fact is that when you talk about somebody identified and then quarantine them or in isolation, in fact, the rules pretty much require everybody to personally protect themselves and isolate. We are in a kind of a nationwide quarantine of sort. So it's kind of like redundancy when we say that we identify somebody. We have to do the same thing everybody else is doing, and most other people aren't even symptomatic and certainly not a threat. So I get a lot of contacts and emails, et cetera, and I'm sure the other supervisors do too, about First Amendment rights, talking about services, things like that, and also the fact that we don't have the right to associate and do a whole bunch of other things that normally we do. And this is the first time we've had a nationwide, I think since the 1918 flu, where we've done a nationwide quarantine of sort. And the reason I bring that up is that I think farther we go down this path in regards to requiring people to stay at home or whatever, is that I think you're going to find more and more either rejection of that and just doing what they think you're doing, which now you've lost control, because now nobody's following anything. They're not probably wearing masks. They're not wearing gloves, and they're just doing their thing. I went to Home Depot over the weekend, and the line was all the way to the street, 6-foot distancing. I'd say 3/4 didn't have masks or gloves. I would say I have to appreciate, as you have, the public, because inside the store, we were all careful of the 6-foot distance. And so I thought that was appreciable from the standpoint of people taking responsibility. So I think these things are happening by some and not by others. But I have a concern. You talk about the religious services, as Mr. Miles has alluded to. I get my services through streaming. It's a very good program. But what people don't understand is going to church is not hearing a sermon. Going to church is about fellowship, is about giving back, is about meeting with individuals and sharing our concerns and thoughts and encouragement, those types of things. And you can't necessarily do that, going back to the platform, et cetera. But I do appreciate certainly Mr. Miles and your openness to making this a little more flexible. These are all things that are important. One of the things that I try to follow, because in the Valley counties, we've been talking a little bit about some things like golfing, but It's interesting to note in San Joaquin Valley with the 8 counties that the ranges of deaths are from 32 down to 1. And surprisingly, the county that has the most is Tulare. It's a rather small rural county. Kern County, which is one of the bigger, is at 5, and Fresno is at 7, and we're at 25. If you compare us, and I like comparison just to kind of see where we stand as far as the rest of the world, but San Francisco has 23 deaths. Santa Clara has 100. And I only bring that up because every individual, municipality is different. And so you can't say, it's going to be this way or that way because it does change. I think the looking at statistics, if you look at California with almost a 40 million population, we've had, and these are a couple of days ago, we've had 33,365 cases. We've had 282,900 tests. 12% are positive. If you extrapolate that out on the population, we supposedly would have 4.7 million cases statewide, 1,227 deaths, and a 0.03 chance of dying, which is really small in comparison to actual cases or deaths. On the other hand, New York State has 256,000 cases and 649,000 tests. 39% are positive. If you extrapolate that out, it's 7.5 million cases, 19,410 deaths, and a 0.1 chance of dying with a 92% recovery rate. And California has a 96% recovery rate. So we're talking on both sides of the country, different experiences. And again, I think the concern I have is that when we talk about COVID-19, and I'm sure you're fully aware that every year we have a flu crisis of sorts, sometimes more than others. But if you look at the flu cases per year, we're looking at 50 to 60 million cases a year of flu. We're looking at 37 to 60,000 deaths each year for flu. Probably about 50% of the population rejects the vaccine for flu for a variety of reasons. But on an annual basis, we don't see maybe the restrictions that we have on this. And I get it. I'm not complaining. I'm not arguing that when you don't know something, you have to take the most aggressive approach possible to prevent it from exploding, so to speak. California, for example, has 40 million. Spain, a country where we're Spain, Italy, they have 244,000. They've had 930,000 tests. 22% are positive. They extrapolates to 10 million cases. They have had 21,282 deaths, and their population is 47, and their chance of dying is 0.05. It's all over the map. And my point of this is not to just recite statistics, is to show that the complexity of the issue and how each individual entity, whether it be a state or a country, has to address their own problems and not worry about the rest of the world, because that's a different animal. So I guess my concern in this whole episode is that the number one question, in fact, almost the only question I ever get, I've gotten one email recently in regards to, which was our golf course issue as far as opening it up. But the number one question constantly is, when can I go back to work? People want to know that. And I understand that. And sometimes it's easy for those, maybe like us, who have a job, who are getting a paycheck, don't understand how a family has no income, can't pay their bills, can't even get food, those types of things. And it isn't just the here and now. And we've talked a little bit, sheriff's touched upon a little bit, it's the potential child abuse, the domestic violence, the drug addiction, the alcoholism, suicide. I mean, go down the list. And these are things that don't end tomorrow or when this is over. They are often lifelong, instances that affect people's lives. And I think we have to consider that the sooner we can open up and get people back to work, we reduce the number of incidents that will have a lifelong effect upon our population. So that's a concern. And I think that I kind of struggle with this, but for example, at Costco or at Home Depot, those are the only two places I've gone to, so I'm pretty restricted. But I know that, for example, at least I've read, that the virus can stay on plastic for 3 days. I don't know how many people go through Costco, but there's a line at every store. So a lot of people go through. I would suspect, because a lot of people don't wear gloves, which I'm not sure that would make any difference because you're touching all these things and then touching your face and all this. But we allow Costco's and places and CVS and a lot of businesses that are, quote, essential to stay open. We have people going through them on a daily basis, hundreds, thousands. There is no containment of this virus per se, because we still have public outings, public exposure. And my point is that, we have, for lack of a better term, exposed ourselves by virtue of these things. Essential businesses where individuals, county employees go to work every day. We have an open society. I mean, we may call it essential. We may say it's restrictive. We may have laid off, for the county, 2,500 workers or whatever, employees. But I guess my question is, and I pose this almost rhetorically, is when we started this, the number one priority was not to overwhelm our healthcare system. That was it. We wanted to flatten the curve, and that's been, I think, very successfully completed. On the other side of it, when I look at the numbers just recently, and we have COVID patients, 23 in our hospitals here in the county. In ICU, we have 9. And this was as of 27th. We have 227 beds, and it's at ventilators, 159. My point is, I think we've succeeded on the protecting our healthcare system. However, I hear from medical professionals and throughout the valley is that our hospitals are laying off employees. Some hospitals are closing floors. They are in dire straits financially, and originally our main concern, based upon a lot of New York publicity, was that we were going to run out of doctors, run out of healthcare workers, run out of beds, run out of everything. And even New York itself, I mean, they overestimated their needs and haven't even used, for example, the hospital ships on Los Angeles and New York have been barely touched. My point is, I think at this point in time, irrespective of what we decided, which I think was appropriate as we learn more and more, is that I think there needs to be a balance. And I know your job is totally focused on healthcare, and I understand the economic side. But I sometimes think that this balance, we need to be a little more, I want to say, aggressive in regards to allowing businesses and the public to be responsible. I think Georgia will be, and some of the other states will be a model or an opportunity to gauge what happens when you open up hair salons and tattoo parlors and maybe bowling alleys and a lot of other things in the next 2 weeks to see what that experience is. But my point is that I think we can move more quickly, and I'm not pressuring you, I'm not making suggestions, just an observation. I think we can move more quickly, and when Supervisor Patty talks about, our contact information, I get it. I understand the lack of staff that you have. I get it that we make calls to find out where people have been and who they've contacted. But, something that I think I would appreciate is something very simple. for the 535 or how many cases we have now, I think a simple list of questions like, where have you gone in the last 2 weeks? Have you gone to Costco? Have you gone to Walgreens? Have you gone here? Where have you gone that you may have contracted this disease? And the reason I say that is because if I knew, for example, that I don't want to pick on let's say Lowe's. If Lowe's happens to be the most popular location where people go that have contracted this disease, and I'm not saying boycott them, I'm just saying make people aware that these are the places that are most susceptible for exposure. So they would at least make some intelligent decisions, because I don't know. I mean, I can say I don't go to that many places. But all those things I think are important, as we've talked about week after week, is informing the public, giving them as much information to make good decisions in regards to their health. Because I believe, and you've stated it, this is an individual thing, that individual responsibility, and there are those who are very conscientious and those who just kind of have a devil-may-care attitude. So again, I appreciate what you're doing. I appreciate your comments in regards to wanting to move forward. I understand the governor's directions, but if he's allowing counties to implement something maybe a little sooner as opposed to later, with much thought and data, and of course testing, I think we can maybe get this economy in San Joaquin County back to work much faster than maybe some of the other counties. And this isn't a race. This is just a matter of trying to benefit our population as much as possible. So I appreciate all that. And again, I don't know, it sounds like you've been approached by trade associations and the restaurant associations. I've seen things that they're talking about having, plexus shield glass around every table. I just think if this virus is going to die one way or the other eventually. It may recur, I get it. But on the other side of it, we're jumping through tons of hoops when in fact a mask and gloves and some personal responsibility, and we'll never have a perfect world where it's not going to happen. There's always going to be cases no matter what we do and how much money we spend and all the regulations we impose. I'm just saying that we have to balance that to provide the quickest and the safest opportunity for our residents to get back to work and get back to that normal life you talk about. So thank you very much.
Thank you. Understood. I did jot down a few things that you said that I want to respond to. In response to your comments with Supervisor Elliott about the drive-up food industry, I do actually have a meeting this afternoon with the Agricultural Commissioner for our county, so I would be happy to bring that up. As far as the social distancing scores that we received that show that people are not really social distancing as well as we may have been. And I know there are many apps out there that are tracking our travel and giving San Joaquin County a bad grade. This is difficult to interpret because we are such a thoroughfare. We are a county through which a lot of traffic moves, especially because of our ag industry. So I take that with a grain of salt because I know there's a lot of trucks on the road and they are being tracked. And because of that, it would appear that too many people are traveling when in fact that might not be the case. I know that there is quarantine fatigue, and that is why I said I would like to move from stage 1 to 2 to 3 as fast as possible. I'm not sure how much leniency the state is going to give us on moving forward on our own. The hint was that really between phase 2 and 3 is where regions may start to enact things on their own. Certainly between 1 and 2, and us being in 1 right now and trying to move into 2, I think we're on the governor's timeline for that. When it comes down to, First Amendment rights and all of those questions about legality, when we do place an isolation order, that is a legal and binding order from the health officer, and we do have authority to do that for the protection of public health. I understand your comment about religious services and the need to have, the actual physical location in order to feel like you have the fellowship there, and this is a concern. Many of the experts that are looking at this do still think that it is a mass gathering that is of high risk. So we will look into that, but as the state has it, that is phase 3. When we talk about succeeding at flattening the curve, yes, we are succeeding, and yes, because of that, I do need to balance our success with rewards to the public that have been working so hard. But if you look at our curve, we're still time-wise moving up the ramp. Although we're not going at that slope, we're on the area of the timeline where we would be moving up the ramp, and we still haven't hit the projected peak time. I'm hoping that we never actually have a peak and that it stays flat, but still time-wise, we have still some more to go before we can say that we have completely and successfully flattened the curve. So there's that aspect too that I need to be looking at time and making sure that the flatness stays and that it's consistent. So thank you, Supervisor Wynn. I have jotted down everything you've said, and I'll take it all into consideration.
Thank you.
Before we move to our next presenter, I just have a couple of comments. One, on the new dashboard, I think it's important to highlight that it's the hospitalizations, the number of folks in ICU, and contrasting that with our local capacity, that those are the numbers you're basing decisions on. Because even with the new dashboard, the two numbers that show up are total cases and deaths. And those aren't really the most applicable numbers that we're paying attention to and that impacts the decision-making process. So I would like to see those three elements: hospitalizations, ICU patients, and capacity in our system. That's the three statistics I'd like to see highlighted for the public, because I think that helps them make sense of things. I hear all the time, how can we talk about flattening the curve? The number of cases is shooting up by 25 or 30 a day. People get confused by just looking at those statistics. So I think if we could bring attention to that, I think it would help the public understand the pacing and why changes are being made. And the second thing that I would just like to say is, as we move forward, and I know you're trying very hard to be flexible and to look at how we go about doing this, I see this as an opportunity to change behaviors in the way a lot of industries do business, in a way that will make them healthier and the public healthier for the long haul. Because as Supervisor Wynn points out, it's not just about COVID. There's flu cases, and there will be other viruses down the road. So I would like to encourage you to look at especially the trade organizations and the industries that are voluntarily putting together very involved and in-depth protocols and procedures that their members are willing to get additional training on and to implement, because those are things that would help keep the public, even if the particular industry might not be considered as low risk. If the industry is willing to implement a whole set of safety protocols, that's going a lot further in terms of mitigation. And I think looking at the actual physical location of where businesses are doing business, if they have the opportunity to go to appointment only, there's only one person in there at a time, I think we need to be responsive to our businesses. And my first concern is absolutely to make sure that we stay safe. I'm glad that you're looking at this on a rolling 3-day basis. I think that's smart. But I really do feel like this is an opportunity, and we're hearing from a lot of industries who, as we did with both the building industry and the real estate industry, they actually even partnered together to come up with a set of very restrictive protocols. I think we should really look at those things as much as we can, because those are protocols that will help keep people safe, that can be easily either remain in place or can be reestablished when there is a flu, every year during flu season, or a new virus pops up. So I don't want to miss this opportunity.
Thank you. That's a very good point, because I am receiving some very creative letters from people in industries saying that they will do their best to socially distance, and maybe they're far down on the line in phase 3, but they're telling me they'll do curbside sales only and touchless sales. And so I understand that, and it's something that I am willing to look at.
Excellent. Thank you very much.
As far as the dashboard goes, this is an ArcGIS system that we have purchased, and I'm not sure if it allows us to put hospitalizations, ICU, and vent numbers on the actual dashboard, but we can go back and look at putting some of those numbers aside it or alongside it on our website. It is very time intensive for our epidemiologists to update this dashboard daily, and so what we've decided is that since some of the numbers, like the number of hospitalizations and deaths and confirmed cases, are already part of our daily reporting that goes out multiple times a day, that we are going to hone that down to once a day of reporting out of the confirmed cases and the confirmed deaths, because it's going to be moving and updating on our dashboard at all times. So in order to conserve some of the time, we're going to be reporting less on the number of confirmed cases and deaths, but it will be showing up on our dashboard daily.
Great. Thank you so much.
So we'll look into the ability to put some of that information.
Great. Thank you.
Thank you, Madam Chair. I wanted to follow up. What could we do that's actionable? What do you think we could do? That's a lot of requests have been made, and I know that at any given time, it's not like only once a week or every 2 weeks you update our provisions of what we're allowed. In particular, I know I've spoken with Ms. Cunningham about parks and boat ramps. Then we've got the season. We've got boat dealers that are sitting on millions of dollars of inventory, and if they're not selling it, they're going to be in very dire straits. We've got people that are traveling outside of our region for boating. We've got it's right now is the season. Right now is the time, and I don't see any reason why we need to keep that closed or restricted at this time. So as it relates to that, also we've got things like Delta Speedway. It's a family event. People arrive as a family unit. There's a little bit of racing going on. There's plenty of social distancing, but there's adjoining race tracks that are allowing, throughout the state or country that are allowing racing, but we're not allowing it here. That's just economic activity. It's viability. It's sustainability. And, we're all talking, and you're very cognizant of the fact that, we need to start walking back some of these things as possible. County council might be able to weigh in on where we are with the pet grooming. I know that we as a county have requested some definitions from the state that would maybe allow us some flexibility, but oftentimes we are limited by what the state's allowing, and some of it here regionally could be subjective. So in particular, I'd like to see what we could do about some parks and recreation and things like a speedway and boat ramps and parks for people, families to get outside and enjoy the great outdoors.
Yes, Supervisor Patty. So I was sort of hinting at Parks and Recreation when I said that as we move along the governor's timeline, and he's talking about weeks, not months, that we are planning to do something in weeks, and there's a lot of demand for the opening of open spaces and recreation, so Director Cunningham can speak to that. Pet grooming was actually an example of something in Phase 2 that was given to us over the phone, but we have made a request to the governor's lawyers to clarify that and to be certain that it's not something we can move forward with now. So that question the answer is pending. We have not received an answer
For
yet.
the pet grooming?
Yes. Yeah.
Yep, thank you.
But Director Cunningham is here to speak to you.
Director Cunningham, what could we do for the great outdoors? Spring is here. We've got 93-degree weather today. We've got the wonderful delta, I guess roughly 1,000 miles of waterways around here for our citizens to enjoy. We've got boat dealers. We've got boat owners. We've got families that want to go out and recreate, and our ramps are closed. What could we do today?
Good morning, Chair, board members, council. CEO Nina, Marcia Cunningham, Director Emergency Services and General Services, wearing two hats. So we have begun the discussion with parks, and my park administrator is currently putting into place. We will need to bring back some of our staff that currently aren't working. We're looking to do more of a soft opening of some of our regional parks. With limited services providing some of those activities, 2 of our regional parks do allow boat launching, so there will be protocol and put in place for that, as well as we're working with council on what marinas and other boat launching areas are going to be able to do. So we are working on those protocols, and based on, we want to do a sanitation of the parks, of the regional parks. We are not going to probably make playgrounds accessible yet for children, but probably around the May 18th timeline. Our next 2 weeks is booked out. It's going to take us that much time to get the parks prepared to open them and, provide so that they can come in through the gates. There's parking. They would be able to, like Oak Park actually has trails. They'd be able to utilize the trails. We're looking at being able to do fishing once again at Oak Grove. So we're looking to bring some of those outdoor activities again by following the social distancing and some of the guidelines that are put in place. But we believe we can do that at this point.
Excellent. So, and obviously the park is a bigger operation. Like you said, you want to sanitize it, you need to restaff it. What about boat ramps? The infrastructure's there. A person can drive up, they can launch a boat.
We have 2 regional parks, Mossdale and Dos Rios, that do allow for boat launching. So we are working on protocols with county council right now in public health for that, and also for marinas.
So so you're saying you have 2, the other ones are open, everything else throughout the county is allowed to operate? You've got River Point.
No, I don't believe they are open. We're working with county council, and I believe once we have what those protocols will be and how that will work, that will come forward too.
So then boat ramps, I mean, again, we're narrowing in on boat ramps for recreating on the Delta.
Correct.
I know you mentioned March 19th or May 19th for parks.
May 18th.
May 18th, thank you, May 18th. County Council, could you give us a brief then? It's not that complicated. I'm sure there are not 250 provisions to put in place for launching a boat and parking a vehicle. What's the timeline for updating what's allowed as it relates to boat ramps?
The issue of boat ramps alone, the problem is that you can't treat boat ramps alone, right? People aren't just taking their boat and launching it. They're stopping and fueling up. They're traveling from some location to the boat ramp, and that creates a conflict with the basic order, which is the governor's order, which is for people to stay home. Right? And so you're creating a conflict by opening up activities that the state has not deemed as essential. So you start with talking about, well, how can we open up parks? How can we open up, then it's boat ramps, and then you add into that conversation, boat sales. The governor, although there is some rumor that this week the essential workers list is supposed to be amended to include things like automobile sales, there's nothing on the essential workers list for boat sales, right? And so the further out you go in that conversation, the further away you're getting from the governor's order, which is everybody stay home with these few exceptions. So it is true. We are looking at, what does it look like to open up boat ramps? And as the discussion was here earlier today, of looking at risk versus essential, what types of protocols would be appropriate? And that is something that we're looking around at what other counties are doing, not only just here in California, but there's, literally thousands of miles of coastline. And so there are thousands of other counties out there that have marinas and these types of operations. So we are looking at the guidelines that may exist in these other places to see what can be put.
When do you think you'll have some information on this?
I don't have a timeline on that yet.
2 days, 2 weeks, 2 months?
I would hope that I would have something by before May 18th.
Or May 18th, so roughly 2.5 weeks from now. So we've got 90-something degree temperatures outside, people with boats or people that want to go boating, people want to go fishing, people that want to recreate. They will go out one way or another. They are going out, but we are somehow limiting the ability and making it more difficult for them to do it. I think we want to maybe expedite the process and see what we can do sooner than that. I would request.
Well, I understand that, but we still have to abide by the governor's order.
It seems to be a lot of other counties may not be. So if we're going to adhere to something at a stricter level, there are people out recreating. You cannot enforce people not going out on a boat. There's not enough sheriffs. There's not enough boats. There's not enough Coast Guard to limit people from going out on their recreation boats, their yachts, you name the size and the spectrum of a boat. It's out there on the Delta.
Well, I recognize that, Supervisor, and one of the things that we have to take into consideration is the enforceability. We don't want to put out guidelines that says, for instance, one of the basic tenets of the social distancing is maintaining a 6-foot distance. So do we regulate then the size of boat that people can be in, or is it, depending on the size of boat, the number of people that can be in there, or do we say only family members within a boat? So that you don't have to be as concerned with that 6-foot distance. We don't want to create a unbearable burden on the sheriff's boating unit to be going out and checking every boat to make sure that only family members are in the watercraft. And so these are all issues that we are examining and balancing and trying to figure out a path forward.
Understood. It's complex. It's not. There's no easy answer. I understand that, and it's certainly not anything that we're creating. Seeing how we can work around it and work within the provisions of what's allowable. I don't know how we could go through that enforcement mechanism. If somebody wants to go out fishing on a boat and we're not letting them launch a boat to go fishing, they should be able to, in my opinion. If somebody wants to go out, if 20-something-year-old people or young family units want to go out boating. I don't think that that's the age group that would overwhelm the medical system that we're most in concern of, that there would be a capacity at the hospitals to absorb the many people that may come in that would be COVID positive and need ventilation and intensive care. So I think we need to kind of evaluate what that risk is. When you go to the boating, it's not a lot of 80 and 90-year-olds that are boating that might have respiratory issues that are at most at risk. So we might be dealing with a demographic that's a little more young, a little more resilient, and able to enjoy outdoor activity without a lot of exposure or risk to each other.
And those are all things that we are taking into consideration.
Okay, I just appreciate if we can move it. I've got boat dealers, and the Delta is my district.
I absolutely understand that. To your earlier question, your earlier statement regarding pet grooming, I did get a response. So yesterday, I sent an inquiry to the essential critical infrastructure worker. Let's see what the email address is. It's actually essential services inquiries at cdph.ca.gov. So I sent a question to them saying we're seeking clarification on whether pet grooming in a standalone facility is an essential service. The essential workers order of March 22nd includes the following. Workers at animal care facilities that provide food, shelter, veterinary and or routine care and other necessities of life for animals. This section appears to be applicable to, that's their statement, so I went on to say this section appears to be applicable to animal shelters, boarding facilities and zoos, etc. It does not appear on its face to include standalone grooming facilities. Possible rationale for deeming such services essential, and the argument that we hear from the industry, is that the difference between people and animals is that the animals are unable to provide the level of care for themselves. If the owners are unable to provide that level of care, then professional care is necessary. Activities that pet grooming may address, including untrimmed hair around the face, which can result in corneal lesions, a potential impact of people because of parasites, fleas and ticks, transmitting zoonotic diseases such as Lyme disease. The counter-argument is that under the existing order, these services are available through some veterinarian offices. And then I provided a list of I said, in addition to considering whether the service is essential, would adoption of the following protocols allow standalone pet grooming services to operate? And then I listed approximately a dozen protocols to protect employees and customers. This morning, during the meeting, I received the following response. Thank you for your inquiry regarding the status of pet grooming under the governor's list of what is essential workforce. Pet grooming employees are non-essential. The list of essential workforce and any updates may be found at, and then it gives the website address. That's the state's determination, is that they are not essential.
And I think that's unfortunate. I think you laid out a really good argument as to why, because there are definitely health risks to humans as well as to the pets. And so you laid out a fair question and evaluation as to why it should be considered. And I'm sorry to hear that the bureaucracy in Sacramento was not sympathetic to the absolute need and the request for proper pet care. Thank you. That's all for now.
Thank you. I think this is an illustration of exactly what Dr. Park was saying in terms of the groomers, that we need to look more at the risks involved as opposed to classifying services as essential or non-essential. That really doesn't have any impact on anything that was sent to the governor's office for clarification. I mean, it was very well laid out. It had protocols. It had everything else in place. And to simply say, well, we're going to ignore all of this because we're saying it's non-essential, I think that's exactly what the public health officers are chafing under, is that's not really helpful at the local level. So we have a couple other questions here, but I think what I would like to do at this point, we have another presentation here of some folks who have been waiting. What I would like to do is I would like to have our briefing on children's services and what is being provided right now in our county. And then if this board wants to go back with these additional follow-up questions, we can call Ms. Cunningham or Dr. Park back up. But I want to, I know that we have staff here that is needing to leave. And so I appreciate the input here, but I think I'm going to go ahead and call Lonnie Schiff-Ross up so that she can move on to what else she needs to leave for. Thank you for your patience. Yeah, we've had a lot of robust conversation here, and I appreciate your willingness to, you and Mr. Woods, to hang in here for the course of the morning to deliver your information.
Good morning, supervisors. Do not touch the microphone that I just touched. My literacy level obviously needs some help. I'm Lonnie Schiff-Ross. I'm with First 5 San Joaquin, and what I wanted to do is just spend a few minutes today highlighting issues of child care and children and families. One thing that's important to know is that the needs are really high right now, but we also know in the months to come, the needs will be even greater. So if nothing else, if you remember nothing else from this morning or my presentation, if you can remember that our partnerships are really what's making it right now. Again, as I talk about so many needs being out there, there's no way any of us individually or even as an agency can solve these issues alone. You heard my boss, Chris Woods, talk a few minutes ago about so many agencies that are working together on Project Room Key, and I would say it's the same thing with the child care issues that are currently going on. I just highlighted 3 other agencies that we're working closely with, and when I say working closely with, I mean daily contact, emails, texts, phone calls, as we all continue to keep each other up to date on what our own work is going on, how we can work together, and how we can continue to offer help to one another. And I will say that through all of the hardship, it's been incredibly encouraging that everybody, and especially on this list, but the list could go on and on for pages, is more than willing to step out of their, this is my job, and work to help others. Some of the things that are going on that I'll be talking about in a few minutes, but you'll be hearing about a survey that's been done for essential workers. You'll be hearing about how we're connecting with vendors to get supplies and providing information on COVID, but again, all in collaboration with one another. So a little bit on the status of childcare. First, before COVID-19 in January 2020, which I think we would all say feels like about 20 years ago, you'll see some of the data on small family child care providers, large family child care providers, private child care centers, the total being 894 in January. Now in April, it's 702. That may still seem like a lot, but that also shows how many right now are inactive, which means they're in essence furloughed. They haven't given up their license yet, but they're not currently open. But I also wanted to stress that of those 702 that are now serving essential workers, it could be they have 2 instead of 14. It could be that they have 5 instead of 24. So of those, and these are all the private centers, so this also doesn't include any of the publicly subsidized programs, our first 5 preschools, our state preschools, Head Starts, etc. All of our programs are doing social distance or distance learning, and I'll talk about that in a moment. But these are centers and homes that I can tell you are all struggling right now to stay alive. What I will also tell you too about these numbers is, so of the 702, Family Resource and Referral now is calling them twice a week. This just started, twice a week to see about their vacancy rate, knowing that vacancies can change in the blink of an eye. But what's also sometimes gets a little bit tricky is that while they may be licensed again, let's say for 14, because of social distancing, taking 14 could also be difficult. So to let you know, again, in partnership with all of the agencies, what's going on and what has been done. So what's been exciting is, again, through working together and working through local resources, we were able to get some supplies out to our child care providers as early as mid-March, when everything really started kicking in. And I'll use the term we, that doesn't necessarily mean me. A lot of times when I'll talk to staff and when I say something about we, it usually does mean like they have to do something. So, but we really has become all of us because we truly are in it together. So we were able to get out various supplies as well as some literacy supplies for the child care provider. So the gloves, wipes, spray bottles, sanitizers, and some books. And then last week and this week, we were able to reach out to 200 child care providers in getting out additional supplies, a gallon of soap, toilet paper, hand sanitizer, and a quart-sized disinfecting spray. And next, we'll be distributing a new order from to enhance what's coming in from First 5 California. First 5 California spent $4 million on diapers and wipes and some other supplies. And the California Child Care Resource and Referral Network is also spending money on supplies. So once we get those, we're in the process of finding out what they'll be sending, and we'll be ordering some more supplies. Because again, as we talk about just doing 200 the other day, there's 700 that are still in need. I also wanted to mention again, in terms of partnerships, we've had community-based organizations, and we're working also with the Stockton Mayor's Office and their connections to get some additional supplies. We also had emergency supplies are going out for 13 family child care providers that are connected to a network with one of our larger child care centers. And we are still looking at getting some additional waivers so we can send out additional retention grants and put together some other funding. So we're really looking at all the different pots of funding that exist, and while they didn't exist for getting supplies out, we're working on getting waivers and exceptions so we can do that. So in terms of what's happening here now, and I believe you're all aware of the HR website that has information for the essential county workers. So we now do have information on childcare. Essential workers are eligible for subsidized childcare. And one of the needs we're seeing is getting word out on that. So thanks to many county departments that it took to get this out, there's now information on the HR website through the county, and all county employees received an email blast last week about this. We also have a survey that was included both on the website and in the email blast. The survey is helping us look at what the needs are of families and essential workers. So far, as of a couple days ago, we had 123 surveys, and we definitely saw a majority of the needed care was for the youngest, the 0 to 5 population. Family Resource and Referral has additional funding to address and meet the need of 850 new slots for essential workers. And another resource that's available for everybody is the website mychildcare.ca.gov, and you can see on that map where vacancies are listed. I would also encourage anyone, they can either call Family Resource and Referral to get referrals at 461-2908, and an email is referralhotline@frrcsj.org. This emergency child care, as of right now, is through June 30th. And as of just the other day, we have about 100 applications from county employees for the emergency child care. So we're really pleased to see that county employees are learning about this. So some additional ways that we're addressing needs of providers through connecting and through coaching. So what we're finding is that programs, and now I'm thinking of the preschool programs, the teachers are doing what we call distance learning in a child-appropriate way. So trying to get a Zoom class of a lot of 4-year-olds is always a challenge, as the little kids like to take their computer through the house to show their preschool teacher the entire house before the parent can grab that computer away from them. But the teachers are contacting families and having contact with families 1 to 2 times a week. It's ranged from packets going out to the kids to, again, the online classes that are going on. So again, first 5 state preschool and Head Starts are continually, while they're officially closed, no face-to-face contact, they are staying in very close connection. And then we also have coaches that are coaching the teachers through this, because needless to say, there's so many new situations. So the teachers are getting additional support. But we also know that the coaches have never been through this. So we actually are bringing in some others that can actually coach the coaches through this. So we can have several layers of support, knowing again the extraordinary times that we're in. But another issue that we really are looking at and acknowledging and working on addressing is the issue of traumatized children. And we know that more and more resources and training is needed. This has always been a focus area. I'm sure you've all heard about the adverse childhood experiences, or ACEs, and toxic stress and trauma. But this has definitely exacerbated all of those issues, whether it's the teachers aren't able to have that in-person connection with kids to see if there's any child abuse or any physical marks, to the fact that the parents are traumatized and that trauma is also rippling down to the children. So one of the things we're also trying to do is use social media as a way of getting word out and getting messaging out there. And then a few trends that we're seeing. So obviously the child care staff, they're concerned for the safety of their children. They're also concerned, rightly so, for the safety of themselves and of their families. They continue to call and ask about supplies, because just walking into, I think people mentioned some of the stores, walking into some of those stores to get the supplies is just not available right now. Very much so, the issue of loss of income is a huge issue. People are predicting that we may lose half of our child care providers during this nationwide. The lack of personal protective equipment, or PPE. Another thing that they're seeing is they're having older kids now in care because the older kids are not in school. And so learning how to shift the activities they're doing, Or what do you do with an 11-year-old and a 4-year-old, because maybe those are your only two children you have, and how do you have a rich environment for them so it isn't babysitting? We've always said childcare is a profession, not babysitting, and so new challenges definitely have come there. And I think one of the other issues that we hear from childcare providers is that they are feeling underappreciated. That as we hear about all of the heroes, and we have so many heroes, and especially in the medical field, that those that are behind the heroes, taking care of the heroes' kids, are often forgotten. One of the other issues, and this is where we're very grateful that we were able to get out the survey and get out information on emergency childcare to the county employees, because a lot of workers, essential workers, still don't even know that they're eligible for some of these benefits. Another issue is that many sites, while they have the ability to add children, the issue of social distancing is quite honestly very difficult. You heard many examples of people not social distancing as adults. And so you can imagine as children that are used to playing together, that are used to hugging each other, all of a sudden being told, here's the yarn, and you can hold the yarn on one side and you can hold the yarn on the other side is truly an incredible process to try to supervise literally minute by minute. One nice thing, though, that we're seeing also in trends is that license-exempt providers have more flexibility to serve children. So before this, license-exempt providers could only serve their family and one other family. Now they can serve up to 10 children. So whether it's 5 families or 2 families, they can take in more children. And so in terms of social distancing, that also helps that license-exempt providers can take on a few more children. And for some people, having like their what we call family, friends, and neighbors watch their kids is a lot more comforting, especially if they are having to go into work. If it's someone that they know firsthand, or again, a relative, they might feel a little bit safer there. So since I'm up here and since I'm part of First 5, I certainly want to take a quick opportunity just to brag about First 5. So you have in the audience today 3 of my commissioners, and several other commissioners are also taking leadership through this COVID-19. So it's really nice to be able to brag about the role that my commissioners are playing. And I can also brag about both my staff who have taken on additional work, as we now have a 25% reduction due to retirements, as well as our amazing agencies that we fund to provide these services. Everyone has definitely had to become a lot more creative in the work they're doing on a daily basis, and sometimes get out of their comfort zone from what they knew to do, but they are all rising to the occasion, and we are seeing amazing services continue to be delivered. I shared about preschools are doing distance learning, so sometimes they're doing the drop-off packets. We talk about the DoorDash, they'll drop off packets, or they'll do the drive-through, and the families will pick up preschool packets. They're doing FaceTime Live, they're doing story time. Virtual IEPs for special needs kids are happening so that those services can continue. Doing physical therapy and occupational therapy via Zoom is definitely a little bit different, but that's also happening. YouTube has become very popular, as well as, again, you all know about a lot about Zoom right now, but trying to get messages out in different ways and having those connections has really been important for all of our programs. Our home visitation programs often will take activity kits, drop it off at the door, and then go back and have a conversation, sometimes by phone, sometimes the Skype, WhatsApp, Zoom, whichever way they can access families. Sometimes home visitors will take their phone and it becomes a hotspot for that family if that family doesn't have an internet connection, and they'll have the home visit with a home visitor sitting in the car and the family there, and then they have that internet connection. So they've definitely become very creative at that. And we have a program called Housing Works, and our housing case managers, again, are doing limited face-to-face. They are working on still getting families into housing. You all know on a weekly basis and daily basis how important that housing is. So these are families that are CalWorks with children, and trying to find whether it's motel stays so they're not living in cars or apartments or houses to live in. We have definitely seen a rise in our referrals of family living in car needs housing than we had before. Before it was in shelter or living on the floor at a friend's house, getting kicked out even of the friend's house, so they don't even have that ability, but a lot more living in cars. So our housing case managers are working on that. But one thing I will say is that we still can never replace that face-to-face visit, but we don't want that face-to-face visit until we know everyone can be safe. And in terms of just the priorities at First Five, we have renewals. So we have contracts that start in July. So a large focus right now of the work is renewing those contracts because we want those services to continue. And then our other top priority is making sure we're making payments to our agency so that cash flow can continue. So that, again, is very much a priority. And then something else we're continuing to do is to promote the census. While there's been some delays there, we know the census brings in funding for programs like libraries, Medi-Cal, and Head Start. So our program campaign, Talk, Read, Sing, Draw, Play, now has Talk, Read, Sing, Draw, Play, and Count, because they all count. And the last slide I just wanted to leave you with is from some quotations from after we sent out $1,000 retention grants. And $1,000 may not seem like a lot, but when you read these, it's pretty incredible to see the response of the providers. I'll just give you a moment to read some of those. I will get really teary-eyed if I start reading those out loud, so I will let you read those. It's important to know that the state is all working together as I talk about the partnerships. California Department of Ed, Department of Social Services, First Five California. The list goes on and on and on about what everyone's doing, from the $50 million for the emergency child care that Family Resource and Referral has. We're waiting to hear, and I think we're supposed to hear this morning, on another $50 million for cleaning supplies that will enhance the work that we're currently doing. Millions of dollars for diapers and supplies. And literally every day or two, we're getting new management bulletins on waivers and shifting eligibility so that the funding that's currently out there can be a lot more flexible. State Employment Development Department as well is another one that's working closely with everybody as child care providers will be able to receive some benefits even if they're still working, but their funding has been reduced. And again, at the county call to respond from Public Health and Human Services Agency, the Auditor Controller, and helping us rush some payments, Purchasing and Support, Human Resources, and the Info Systems Division. Everyone has been truly amazing at doing whatever it needs to take. Again, just wanting to highlight some partnerships there and leave with any questions.
Thank you so much. Supervisor Elliott?
Well, thank you, Chair. My comment wasn't really for this one. It was
Oh, okay.
for the general discussion there.
We can come back then. Well, I'll give you another opportunity. I have a quick question. You said that Family Resource and Referral Centers had 850 more slots available. Are those slots available to anyone county-wide? So I'm thinking, I know that we had subsidized childcare for our essential workers, but I'm thinking of other people throughout the county who are essential workers, either in the healthcare industry or first responders' families or teachers' families, whoever. Right. Are these 850 slots available for them, and how do we help get the word out?
Yes, great question. Thank you. So that is for everyone, including the county employees. So it's 850. And right now we want people to know about it so they call in, because once those slots are gone, unless the state or someone else gives some additional money, those slots are gone. So we are trying to advertise again through social media and other means. Specifically for the county, we had some strategies, but now we're really looking at social media as one way of getting word out on that child care.
And so many folks in essential services are represented by unions. Are we actively pushing this information out to the various labor groups countywide so that they can notify their members?
I don't know that, but that's a very good point, and I will definitely see how we can get that out.
That would be
Thank
great.
you.
Because some of the emails I've received have actually come from labor
Right.
groups saying, we'd like to help. What can we do to help? Can we partner with the county on this? But the last thing we want to do is duplicate efforts. So if there are 850 slots available, really the best thing we could do is pass that information along to them and say, we want to fill these first.
Definitely.
So let your membership know, here's how you can take advantage.
Thank you for that. I do know that there has been some outreach to the hospitals and some medical facilities as well, especially the survey that's gone out. So people are starting to become aware of it, but we do know we need to get word out more.
I think we should definitely key in on labor as well, because they're very effective at getting information out to their membership. So we should be back with that. Any other questions?
Little comment. Thank you, Chair.
Bet.
Thank you, Chair Miller. I just wanted to acknowledge what a great job you're doing, Lonnie. I'm on first five, and I always want to say that I enjoy the committee. I know Commissioner Park, Commissioner Woods are here, and we enjoy what you do and all the leadership you bring to our this team, and appreciate all your leadership. You do a great job.
Thank you.
Thank you.
Thank you. I also, we were on a call yesterday looking at developing some additional funding streams and how do we partner and be the most effective at providing these continued resources for our youngest and our residents who very often don't have a voice in speaking out for their needs. So all of you and the commissioners as well, you do a wonderful job, and I say very often, I leave these task force meetings and sometimes I'm almost overwhelmed by the amount of the shared sense of mission that everybody in the room has, that it is really all about our kids and how do we help one another as organizations and as individuals to do the best we can for them. So thank you. I appreciate the update, and as things progress, we'll touch back with you. As you said, these needs are actually going to increase. They're not going to, it's not going to be over when folks start, being able to get back to normal a little bit more. A lot of these things, they're going to be greater need. And so we'll look forward to hearing from you about how best we can support those efforts.
Thank you so much for all of your support.
Thank you. Okay, so I think we'll pick up some of the additional questions. Supervisor Elliott, you were next up, and you've been very patient waiting. Thank you.
Thank you, Chair. So I would just like to make some final comments here, and some of it to highlight what I brought up last week as well. But as Dr. Park mentioned in her presentation, our original intent with all of these measures was to flatten the curve, and we've made great progress in doing that. So the question arises, how flat is flat enough? And then flat at what level? Does it need to be at an extremely low level of hospitalizations, or if it's flat and at a medium level of hospitalizations, do we still have enough capacity left to handle all the surge capacity that we think we might need? So I agree with other comments that were made that we need to put a lot of that focus on just the capacity of our healthcare system. We put considerable work into expanding the surge capacity of our hospitals. So perhaps we should be looking more at that rather than how flat the curve is. do we still have the capacity? And is that sufficient? And then looking at just the whole idea of what measures are most effective in terms of protecting people from coronavirus. I brought up Sweden last time. They haven't had any nationwide lockdown like we've seen throughout the U.S. and in some parts of the U.S. more than others. And yet they haven't had any particular surge in terms of new cases. I read an excerpt of some results of a medical briefing that were given where the doctors who were giving the briefing said that just considering all of those factors, it's not really statistically significant whether you lock down or not. So I think we should focus our future efforts on trying to open up as much business and as much recreational opportunity as we can. We can try to continue our education efforts, impress upon people the necessity for social distancing, wearing masks if necessary, and frequent hand washing, that sort of thing, as opposed to trying to keep our businesses locked down. So while we do have to consider the governor's 4 phases and the things that are listed as belonging in one phase or another, I think there can certainly be some flexibility in terms of what phase something comes in. And I think our focus should really be on how we can lower the risk. So even something that may now be listed as a high risk business, if we put certain criteria in place to manage how that business operates, or how those interactions happen, that can become a low-risk business. So I think we should look at that in terms of how we approach our moving forward here in terms of getting the county back to work. And I think that should be our focus. Thank you.
So thank you, Supervisor Elliott. Yeah, I understand that we have to look at how this disease is transmitted, and you're right. It's still respiratory droplet and possibly contact transmission. And so how do we reduce those risks? And the problem is that we now have on top of that lots of evidence of asymptomatic transmission. So we might be able to really tell people to check your temperatures of your employees and check the temperatures of people who are entering your stores and ask them about symptoms, go through this symptom checklist, and as long as everyone's symptom-free, it's probably safe. And it probably is, but there's no way to get down to zero risk because of the people who are asymptomatic and possibly able to spread without any signs of illness at all. So you ask how flat is flat, and this is what I was trying to share with you earlier. So I can see it. So if you're looking at the table called hospitalizations percentage change, that is really what I want to focus on. It goes from March 2nd all the way down to April 26th. And I apologize that the public probably can't see this, but if you look on March 2nd, we had our very first case, so the number is 1.0, and then it goes down to through April, and then ends at April 26th with 123 cumulative hospitalizations in that middle column on the right side table. If you look around April, let's say we go to April 21, the percent change was 3.4%. Then on April 22, it was 0, with no new hospitalizations. April 23, we go to 1.7%. April 24, 0. April 25, 0.8. And April 26, 0. So what I was trying to explain earlier is that I'm going to be looking at 3-day moving targets to see if this number goes up, because this is the whole number that's driving the curve, and that's driving that red line. And what I want to look at is, are there going to be 2 consecutive 3-day moving targets where we have a 2 to 3% increase? Because that would be concerning and would tell me that our red line is going to start moving up the curve. And you can't see on the right side of the curve where that ends up going, but that is our flattened or mitigated curve that we've shown on previous models, where that green line, this is cumulative hospitalizations, so it would be overall hospitalizations, not just the ICU and the vents, but the total number. But in essence, it is that flattened curve where we have that green line going up, 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 peaking on May 30th. So as I said, time-wise, we are still at the beginning of that potential surge, and it doesn't look like we're surging, and I hope we don't have a massive surge. It looks at this point like our hospitals have definitely met surge capacity. We know that they have, and that they are ready. But if we start to move up that curve and follow along the green line, that's bad news, because we will get to that peak, and that is a peak that I still don't think I would like to see. Even if it's a flattened peak, I think our hospitals would be strained at that peak. So this is what I'm looking at. These are not by 3-day intervals, but we're going to start to look in terms of 3-day intervals as far as the percent change. And I'm going to be looking to see that that stays stable. Right now, it's overall like a 0.5% change, which is very encouraging news. So, as I said before, we're really looking for the public to help keep this curve down. So that's, in answer to your question, that's when I say flat, that's how flat I want it.
Right. Okay.
That answers that.
Okay, and that's a reasonable approach to looking at things. I'm glad to hear, though, that we are not looking to reduce the risk to zero. We're trying to keep low risk as our goal. And again, I just think we should, whenever we're looking at what list comes out of Sacramento and the factors here on the ground, I think we should be looking toward those things that we can say are making our operations low risk, and therefore we should move in the direction of trying to allow as much as possible.
I understand, as I said before, I am going to try to be reasonable and flexible, and I appreciate all the plans that industries are sending me. Because one industry sends me a brilliant letter and tells me how they're going to social distance doesn't mean I can really say that everyone else is going to be able to do that, which creates the conundrum. Is if I have a hair and nail salon telling me that this is their plan of how to reopen, and it looks like a wonderful plan because it's one customer at a time in one unit, no more than one person with one person, and they're going to use masks and gloves, that's not to say that I can open to everyone else that will have 10 people in one space at a time and won't be wearing masks and won't be wearing gloves and won't have people stay out in the car until it's time for their appointment and get texted. So people are sending me very brilliant ideas, but it's very hard to say that that one idea is something that's that can be repeated by all. And so to open up an entire industry, knowing that not everyone can accomplish that, is difficult. So I have to work with council and think, do we open up certain businesses and not the entire sector, or how do we move forward with people who are showing us these creative plans? So I am going to be flexible and look at that, but I have to try to be equitable at the same time.
Great, thank you.
Thank you, Dr. Park. I see Mr. Birch standing in the rear of the chambers, and I'm wondering if perhaps he has some information for us.
Excuse me.
Good morning. Almost afternoon, but good morning.
I remembered my water today. I'm going to need it. Thank you, Madam Chair and members of the board, for the opportunity to speak today. I think I do have some information based on the questions that members of the board have asked on capacity and availability at our hospitals to share with you. First thing I'd like to share with you is that there has been a change since my last briefing on Tuesday, and that the state has made the sleep train alternate care site available now to San Joaquin County hospitals and skilled nursing facilities for the transfer or discharge of a certain category of low acuity COVID positive patients if necessary. So that actually increases our capacity even further. Additionally, I just completed a survey that the state asked us to complete, and just by adding in San Joaquin County's numbers without all the other counties in Region 4 reporting, by adding our surge capacity, we've now exceeded the governor's entire surge targets by more than 78 beds just in our 11 county region. So I think we have plenty of surge capacity in theory, right? We haven't executed it, but in theory, what the hospitals are reporting and what the counties have created through alternate care sites with Sleep Train and others, there's clearly plenty of capacity in our healthcare system as it stands today. And so I do have a PowerPoint I'd like to go ahead and share some of the actual data on hospital admissions that we have, similar to what I showed you last week. So here's our current graph. We now have 30 days of actual data that we've submitted, or that's been provided to us by the 7 acute care hospitals in San Joaquin County. So we're not getting this we're not getting this filtered from the state. This is directly from our hospitals to our office. And so what you'll see here is three lines. We have the number of hospitalized COVID positive patients, which has ranged as a high, I believe, of 38, and today is at 25. We have the number of COVID positive or COVID positive ICU patients, which has remained fairly flat. As my medical director, Catherine Schaefer, just shared with me, we could almost say these are static numbers. They're so consistent over the 30 days. There again, we're only at 9 ICU patients today, where we started 30 days ago, we're at 9 ICU patients. The black line that is more variable is patients under investigation. What you can see there is the variability in that. But actual hospitalizations, the daily census, what the hospital administrators and the chief medical officers track, has been flat from the beginning, once we've had our first cases. They're pretty happy about that. We don't see any increase in hospitalizations. So even though we have more people testing positive, it's not showing up as in our hospitals. That has been in a very controlled range for what we can see. So this graph, started looking at how are we compared against where we should have been based on the model projections of daily admissions that public health had originally on the Bayesian model. And so today is April 27th for this reporting day, and we should have had just over 100 cases based on projections admitted today, not cumulative. The original projections were daily admissions, and we're nowhere near that projection. Same with ICU cases. The daily admission rate today would have been, I believe that's 38, and we're at 9 total. So the projections, luckily, didn't come out to be true. So two things can be true, right? The projections could have been overly aggressive, and the state shared that in their modeling conference call that we had, that even the state's projections were overly aggressive based on what the actual data has come out. In addition, the sheltering in place and the non-pharmaceutical interventions have worked. So both have played a role in keeping these numbers flat. So what you're seeing now, just yesterday with the governor's office, he talked about it in his press briefing, but they issued a resuming California's deferred preventative health care guidance to clinics, doctor's offices, hospitals, skilled nursing facilities, to essentially say it's time to, with proper engineering controls, to reopen the healthcare system. And so hopefully that's something that we can see locally occur, because we clearly have the capacity to do it, based on the numbers that the hospitals themselves have been reporting. And so I think that that's one aspect that we have very good numbers on for our counties. I'm very pleased about that. And I agree with you that tracking that the daily census against our capacity is a true indicator of what our risk assessment is for the county versus total cumulative numbers. With that, I'll go ahead and open up for questions.
Any questions for Mr. Birch?
Well, those are encouraging numbers. I think this kind of is a perfect example of when we started down this path, actually beginning of March, late part of February. I'm talking about nationally. We've been dealing with theories, based upon whatever. I mean, the input for the models have come out with these projections, which your graph shows were way aggressive in regards to what actuality has occurred. And I think, I wouldn't say we'd throw away the models, but I think the models have served a purpose, and now we have actual statistics to show us where we are and where we can be or should be. And I really appreciate the fact that we've actually have the lines of actual numbers as opposed to, what's it going to be in May 15th and June 30th, et cetera, because, working from zero or nothing to where we are, I think our ability to make decisions is well grounded, as opposed to trying to base it upon, these numbers that didn't apply to either this state or this county. So I appreciate the way you're putting that together. And I would agree that hospitalization certainly or ICU on a daily basis is really a good indicator. The part about the number of cases, the more testing we're going to do, the more cases we're going to have. So that number is going to naturally go up. But it's the actual, patients that are hospitalized or ICU are a true indicator of where we are as far as our healthcare system. So I'm glad to see those statistics.
Supervisor Elliott?
Thank you, Chair. You mentioned now that there's desire to reopen the healthcare system. Now, you had given us a report earlier about reallowing scheduled surgeries. Now, is that just in San Joaquin County, or is that statewide now?
The governor made that a statewide opening. And these are statewide guidance, and the recommendation is that counties should be looking at both local and regional models and opening up in cooperation. But I think when you look at the 11 counties of OES Region 4 and our total capacity in those 11 counties, which includes Sacramento, San Joaquin, Stanislaus, and the foothills, that I think our region is positioned very well to move forward with reopening the healthcare delivery system.
And when will we do that? Are we already starting to schedule these surgeries?
When I spoke with the hospital administrators and chief medical officers last Thursday, they all had plans to begin initiating elective surgeries on a kind of a phased-in approach, starting with on essentially May 1st. I think some of the hospitals have already started ramping up, but literally going into the first and second week of May, they were looking at kind of turning the water spigot back on, so to speak, when it comes to elective surgeries and other things that have been delayed. And they had a priority that they were working through. They're still managing that, and they'll still have to manage for themselves what their own internal capacities are. Because where we have surge targets, if the pandemic were to hit and we would go to 1,900 beds, they're still managing within their licensed bed capacity based on their normal projections for daily census and how much how open that they want to become. So they're going to manage their own hospitals. But I think the message that we want to start sending out to the hospitals, into the clinics, into the private practices, is that the governor has now green-lighted you to put in the engineering controls that you can safely start seeing patients again for preventative and delayed care.
Great. Yeah, I think that's important for the financial health of our hospitals, our clinics, just our medical health care, our doctors. I was talking to a doctor just yesterday, and I asked him how he's doing, and he said, well, physically we're doing fine, but financially it's not so great. Yeah. So we need to look to the financial health as well of our healthcare system.
I agree.
Thanks.
Great. Any other questions for Mr. Birch? Okay. Thank you. Thank you very much. Is there anyone else we need to hear from this morning? Okay. Thank you. Supervisor Patty?
Thank you. I had requested a question earlier when Dr. Park was speaking. So through the chair, if I can also have Dr. Park up, I had a follow-up question for her. In the meantime, question for our CAO, Ms. Nino. You had mentioned our CARES Act money coming in, and I know that there's some counties that are doing some stimulus money on their own. Could we maybe come back to the board with some options that we might be able to apply perhaps some of that money to create some stimulus for our local businesses that have gone through hardship by no cause of their own, and maybe see what we can do. I know Stanislaus, I think, allocated $1 million for their county, and even the city of Stockton had allocated some money for their local businesses, like $5,000 grants. So if we have some money coming in that's COVID related, we might be able to look at what other counties might be doing, or create something unique for our own county and utilize some of this money for businesses that we could help them from being out of business permanently, and some relief might be helpful to keep them here and viable in the county.
A number of great minds are thinking alike. Last week, I sat down with our CEO of our hospital, Mr. Culberson, along with our healthcare services director, along with our director of general services, our OES director, and a few others, our auditor controller, to discuss some possibilities. Economic development as a result of COVID negative impacts is one of the categories that is part of the CARES Act funds. So we will bring some recommendations along some of those similar lines. And I've heard some feedback from a few other board members along those same lines. And so one of our department heads brought up an excellent point. As Supervisor Elliott just stated, a number of our healthcare service providers are struggling. Our clinics, our community medical centers, may not come back the way they were previously. I probably saw 3 articles over the weekend relative to healthcare. You know, we rely upon our healthcare partners. So given industry is extremely important from a workforce perspective, and us having the ability to have our community go back to work once this is over and along the phases that Dr. Park has mentioned. But at the same time, what is that going to look like, as you're stating, Supervisor Patty? So our goal, we will be making some recommendations along the economic development side for both industry, but also our healthcare sector partners, because that is a big industry within our county that is suffering terribly during this crisis also. So we will definitely be including that. And then whatever direction the board gives us. These are just staff's ideas, and then we can get that direction. And our goal is, I know originally it was planned for the 12th, but we might be able to get it done sooner for the 5th. But I'm looking at the date here, sitting here thinking more than likely it'll be May 12th.
And you'll come back with some suggestions?
Yes, we sure will.
And just a quick follow-up, myself and Supervisor Elliott have held a couple of weekly calls with our chambers of commerce and speaking with the CEOs of those chambers that represent hundreds of businesses. We cannot leave our business community out of the loop. Obviously, we do want healthcare, but if our tax bases that come into this county drop significantly because businesses are no longer here, then we're going to be in even greater challenges down the road. So we obviously, as you're noting, we need to consider a lot of factors and keep them in the loop of what we might be able to do to help them sustain the operations of their business and the employment of local residents.
University of Pacific, I mentioned their study last week, I believe. We're also taking that in consideration as part of some of our recommendations of the industry sectors. I think that report came out probably about 2 weeks ago, and it was well done and very informative, and it was focused on parts of San Joaquin County.
Would you send that to my office, please? I don't recall receiving it.
I sure will, and I'll send it to all the board members.
Thank you. And then just last quick follow-up with Dr. Park. You mentioned a great word, of course, flexibility, and looking at how we can utilize some possibilities of implementing for business as we're talking about. What type of flexibility, if any, would we have in the restaurant sector? Again, what's essential, non-essential? They're allowed takeout and delivery, but do we have any flexibility to allow restaurants to open it with 30% capacity and just see how that works? And obviously, plenty of spacing and giving protocols. And as you mentioned, some industries have presented to you ideas of what they could do for, let's say, hair care or nail salons. And coming up with guidelines that could be adaptable. Businesses will willingly make those adaptations to ensure public safety and compliance, just so they can operate to stay in business. So, what type of flexibility, as it relates to restaurants, would we have to open up, a little bit of capacity for indoor dining?
I guess that's a good question. I don't feel the need to move at much of a faster pace than the governor on that one. Restaurants are able to offer takeout and delivery services, so they're open for the most part when they're able to do that. So unlike other small businesses in retail, they haven't been completely shut down. So again, we would have to look at risk factors, and I don't know if County Council has any thoughts on what sort of flexibility or what sort of measures we would use to address that specific industry.
Sure. And as it relates to that industry, there's obviously chefs and there's people that could help take out or delivery, but there's also those that work in the service industry that are waiters and waitresses, and they support their family that way. So if we can start to bring some of those jobs back online, that would be very meaningful for a lot of people in our community. County Council, do you have any understanding of what type of flexibility we might have as it relates to a partial capacity at a restaurant?
Looking at the governor's order, I don't believe that there is much flexibility. I don't think that the governor's order, the way that it is created, or their list of essential workers, is intended to create flexibility. So we're trying to build in flexibility at the local level. And so we're necessarily going to have some bit of a clash between what we may want to do at the local level, what our ability is to do, and what the governor's orders are. So as the orders exist now, I don't think that there is much flexibility, but it's something that we can look at going forward, and it'll be interesting to see what it is that the governor shares in his briefing today.
Sure, and I'm not aware of any counties that are allowing partial occupancy for restaurants. So I'm not suggesting we're the first, but I'm just keeping our fingers on the pulse of what's needed as we go forward, and perhaps if the governor gives a little bit of open interpretation or some flexibility, then we could look at that sector as well.
I'm not aware of any other county that's moving forward with that particular concept either.
Yep.
Most counties are operating within the governor's orders, and where there's not clarity is where they have some room to move, but the orders from the governor are very clear when it comes to restaurants.
Sure. Okay. I was just checking. Thanks.
Supervisor Elliott. Popped up.
Thank you. I already made my comments.
Okay. There we go then. Thank you. I think that's it if we don't have any other questions for Dr. Park. Are there any final comments from the board at this point? Then we are adjourned to...
Madam Chair.
Oh, excuse me.
Sorry, we do have one more public comment if you'd like to hear.
Excellent. I'm sorry.
Okay.
I forgot to ask.
That's
Yes,
okay.
please.
This is unsigned, and it states, the workers at San Joaquin General Hospital Patient Financial Services Benton Hall are forced to have regular meetings where social distancing is impossible. My coworkers and I have brought this to the attention of management, but they do not seem to care and continue this unsafe practice. I advised Lovetta Jones minutes ago that I was going to email the Board of Supervisors about the problem, and she simply shrugs and says, go ahead. There needs to be accountability for social distancing within San Joaquin General Hospital. This continued practice of ignoring social distancing is dangerous. Thank you for your time. And that's it.
Thank you. And I'm just going to ask that perhaps the board get some feedback on that from Mr. Diedrich or Mr. Culberson or whoever we should, or perhaps it's from you, Ms. Nino, but we'll wait to hear back. Thank you.
Believe that is the hospital finance, not our healthcare services, that is making that request. So we will follow up with this board.
Perfect. Thank you very much. Then we are adjourned until Tuesday, May 5th at 9 a.m. in these chambers. Thank you, everybody.